update your system 100%, so how come I'm not getting this shit?
Hello, hello.
Hi there.
I gotta figure out.
There used to be some.
I know, right?
Huh? That's what I'm saying. There's no coffee in there.
Thomas ain't making it tonight.
No.
No. I was gonna make it. My truck to the bed and the garage won't get it in until next week.
Ouch.
So I had to steal my brother's car just to make it tonight. Had to leave him without a vehicle, so. It's been a crazy week,
There's a couple.
crazy couple of weeks.
Yeah.
It's absolutely destroying that trip.
I know. I need to find some tape to put over that instead.
What season are you on
I'm bad. I don't want to talk about it. I finish every season that I have available to me because 9 I need to pay for. So
So, yeah, spend the season 8.
No, you want the paper nine. What is that?
Hulu.
Is it Hulu?
Hulu, they have all the news.
really,
Because,
Garrett, scratch that. I just gotta change my streaming service.
Hulu's only like.
so you saw it with this guy.
Huh?
You saw it with this guy.
Oh yeah. Yep. That was
That's why I
nice.
told you, don't get attached to nobody.
I don't use. Okay, so you told me not to get attached to anybody, and like the 3 episodes after you said that, Shay died.
Yep.
And I was like, okay, so she's getting real serious. And then I got to the point like after that happened, I was nervous for like 4 episodes, 5 episodes.
There we go.
I was just always nervous because like, is it great? Someone else is gonna die all the time, and like not really though. Like Shay died, and then like nobody else. They all just kind of like left. Like Gabby left, fucking Keith left.
That's the one that makes it the most fun.
Mills, I like him. I like Gallo. though.
Yeah.
I like him. I looked up why they chose Otis's character, and it was literally because everybody liked him, and he connected with every.
They were gonna
character.
do, Ritter,
Oh really?
but Otis would have had more. We just watched that the other night. Chocolate chip and
What that episode?
we watched like a behind the scenes thing and explained
Oh,
why.
explain why. His character was kind of, or his the actor that played it was kind of mad though. Oh,
What you think?
he's like you're basically firing me because I'm doing the job well. And I mean it's true, but
What are you getting?
you gotta do it.
Give me some prostitute. Yeah, that works. Thank you.
Apparently a 2-bedroom apartment down in Tennessee is only $900. My house down in Tennessee is pretty cheap too.
But
Just
if
around
you-
$1,000.
factor in the cost of living down there, it's about the same as.
Yeah. If I made Vermont money and lived down there, I think it's set.
If you lived in made Vermont money,
Where
you
in
lived
Tennessee?
anywhere.
Where in Tennessee?
I don't know. Where'd Russ go? You know?
Pigeon Forge.
There. Yeah.
You can move.
I think he is. I'm not. I think Russell is.
Yeah, at some point he wants to. He's looking for a place down there.
I told him he better stay here. He goes, yeah, I'm thinking about like, next year at some point. I was like, Russ, you gotta work with me on AmCare a little bit. Or you just dip.
Oh, yes, this works too. Holy crap. It'll be a good night. Sweet. Is it double bonus? Okay, so I'm doing a recording different from what Joe does. I'm doing it through Zoom. You can figure it out from there. Joe knows that stuff better than I do. At least I got it recorded.
Did you have to redo that other one?
Yeah, I think so. I'm not sure what we're gonna do about that.
I don't think it was even the biggest deal.
Two. I'm hoping we can get through it all tonight, but it's gonna be close.
What happened to, I don't want him. It's all right.
Dropping off kids, flying to Seattle, spending the day with my brother. Flying back.
You're not even gonna like it.
Coming back over here. And then first thing Monday, actually when I get back, I don't even know how many hours I'm gonna sleep, because I have to be down.
Wow.
When's that? NYD.
Chicken, bacon, range, pickles, cheese.
Correct.
Every time I get Subway, it's been flatbread or a wrap. I don't mess with that. Right. Unless it's Italian or not boiled. I worked at Subway for a while. So I hated it.
I used to work in the Maple Field, just where it had the Subway in it.
Yeah.
That was usually my lunch.
I've noticed that like everybody that I've seen that works in their Maple Field, at one point or another, you'll go in and just be behind the Subway counter.
Yeah.
I don't know if they just kind of like fill people. I just like need or. It's like they're building a whole new gas station on Main Street.
Yeah.
Yeah.
Here?
Is that supposed to be another gas station?
I don't know. I drove past it today. It looks.
They're gonna have. They're down.
It was, when they're putting it across from Walmart.
Okay, so.
Subaru dealership.
Subaru, handy Subaru.
You wouldn't go.
I called it. He's like, oh, no, there's not gonna be a car dealership there. It's posted. He's like, where's that one? Right across the Walmart.
Well, Handy's bought it. Yeah, I mean, of course it's gonna be a car dealership. Handy's bought it 3 years ago. I don't know why.
Maybe about half of it, and then the RV place bought the other half. Then the RV place went out of business, they sold that the other half.
Probably shouldn't have bought the house.
They lost money on their house.
The rumor is that they're going to be building a Red Lobster next to
Red Lobster?
Walmart. I mean,
What?
yeah, I heard that. As
Yeah, I know what you're saying.
they don't even have one in Burlington. I don't
Yeah,
think
it's,
that's-
it's,
I'll
it's
buy
shorter than, I'd love to see like an
Yeah.
apple.
And then-
That'd be a little bit more. An Applebee's or even like a, Texas Roadhouse.
I would love it.
That would be great.
This place to keep that.
A lot of
Lake Georgia.
So,
Friggin' better be.
Yeah, and that's
After all this shit they've been doing for years.
the amount of development.
I'm so sick of the, I mean, I live in Englishburg now, so I don't care much, but when I lived out here, like, everything out here is either Chinese food, fast food, or car dealerships.
Yeah, it's the same stuff.
Same on Delaware Road as well.
I mean, that's like, I remember one time I sat there when I got off 189. And took a left on Shelburne Road because I was going up to the Shelburne Museum. It was 2 hours. And I decided to count how many dealers were here. There's 20,000 gas.
It's 20.
I used to work in the dealership with
New York
Shelburne.
There was this. That was a couple of years ago.
Yeah, I emailed that.
It's
He
all
did
dealers.
too. It was fun.
The Toyota, that's up there. No, and Shelburne.
I did auto in, high school. And that's-
My dad bought a Shelburne. He just
New York.
Morning.
For you, maybe.
It was kind of sick though. My job at Heritage was they have an offsite lot down
Your
by
grandmother and
yeah.
mom.
And they store the trade-ins down there and brand new cars off the truck. So my job was to like drive up a new car, drive up a new car and drop on the trade-ins. No, it was sick. I drove some of the nicest cars I've driven on that job. I drove a 5.0 Mustang one time.
I got to drive the owner's Viper, and I always loved that cars. I hated it. I could take my boots off because my feet were hitting the gas and the clutch. And then I was right on the shade. I hated it. It was felt so claustrophobic. If you sold it, the guy that bought it, gave me a big boy. And I was like, I felt claustrophobic in the thing. No, it was not fun.
So what you're saying is I should buy a Viper.
I would want.
Yeah, it would work out well.
I do inspection on it.
I've been thinking about years for getting a new marijuana, like, cause I want so bad.
I don't want a sports car.
I've tried it 3 months out of the year. My dad bought a
That's the thing is, what am I going to do with a sports car?
I'm past that in my life. My next deal is gonna be a nice pre-owned F-250.
I don't work. That's why I do like plow in the winter time, like construction.
I thought I was done plowing until I found out that AmCare does their own driveways.
Over there.
Well,
I mean. By their.
A lot cheaper than I or something like that. Right. I see how much I charge people. I want to pay someone. Oh, I know. I just work for my dad.
It's not bad, it's good work.
it is.
It's long days, long days.
I did that on Valentine's Day storm. That stuff. That was just 48 straight hours.
This past February.
No, it was back in, was that 2014?
That was, yeah. Oh, the big one is 15 was 14. Yeah.
I've been trying to get a
McDonald's.
Yeah.
24 hours?
It was really good skiing.
I bet.
On Valentine's Day. And
Yep.
then the next day, it got all windy up there. So it never even happened. All they did was worse. It's like crazy.
Oh,
We're all just like, what happened? What?
just got 4 feet of snow. and
So
all
good
these
yesterday. We were
people,
setting off that.
Oh, yeah, yeah. Yeah, we killed 2 trucks during that storm.
All right.
Transmissions. 1 minute. and we're gonna get down.
Everybody's got big trucks and stuff. We just grab the Farmel or the Ford tractor, the bucket loader and go down the road. Plowing out other people's
There are
driveways.
people in our town that do it. They have the old Ford little tractor with a bucket on it, goes multiple driveways. Yep.
It
They
wasn't
took about
bad.
an hour to get there.
Right after that storm, we went and bought a Kubota and we bought a 60-inch snowblower.
Yeah.
My landlord tells me when my student gets through pretty much anything else, so I love that car in the winter. It's the best choice I've ever had. Oh yeah. I've always had like piece of junk, $600 beater tires with I've never bought winter tires. Not once in my life have I paid for winter tires.
My problem is I live dead center of town, and where our house is, everywhere you go, you have to go up a freaking steep ass hill, so you can't have
Did
two-wheel
not
drive.
make it up.
Our first year when we bought the house, we had a 2-wheel drive car, and never again.
Oh, yeah. My girlfriend's grandparents and family, they live up on Stevens Mills.
Oh, yeah.
Which is
That's a nightmare.
There.
To get up there. Oh, I know.
This is like a couple weeks ago, I was off of exit 20, like get onto the main road and roll up, and there's these 2 girls in this car. And it's like, you could tell they had like snow tires with studs still on it, and back right one was the donut.
Yep.
And I'm like, either, okay, I can understand your financial, it's great, but that's just gonna cost you more money when you blow another tire.
Yep.
You know?
Destroy that one. That intersection is one of our popular accidents.
Which intersection?
That one and the one by Handy GMC.
Yep.
That intersection.
Yeah.
We go there all the time.
That doesn't surprise me, you know,
I personally called in at least 3 accidents right there, just driving along and the person in front of me just.
See, nice about Bridgeford is we have a lot of idiot drivers, but they get in their car accidents in Berkshire, Venusburg, so we don't have to deal with it.
Yep.
They do on the straightaways when they race.
Oh,
I
yeah.
tried to race that bike to turn left to go to 89 north to south.
Yep.
Only then somebody else is coming.
Every accident I've been to, we had out of staters.
Yep.
Every single one. They roll over last winter. It was out of stater. I'll take that back. They had to roll over going up Jay. And that was one of our local people. I don't know how we did it, but rolled the car going up the hill.
Is that who I think it is?
Yeah.
I
And then we had the dude a couple weeks ago that was running from the cops that hit 2 cars. He wasn't from town, so.
Is that the Enosburg one? Is it Schwan's or no?
No, we had, oh my God, I'm happy to, but we had a guy that had like 7 warrants, and the cops were chasing him
Yeah.
down.
guess it
And
didn't
he
get
lost control.
Felicia and-
Did he get Derek's email?
He lost control, hit one car and smoked another car, and he took off on foot barefoot. They chased him like 3 miles. And they caught him.
I'm gonna give him 5 more minutes. We're gonna get going.
Rick is done, and I'm pretty sure Felicia and Derek, they're not here. Right. Aren't gonna be here today, so.
Yeah.
No. I think they said Thursday and Monday they're not.
Yeah, they went away. Okay. Thomas said that's what he was there, so good.
No worries then. We're recorded, so if you can watch it, they can. So if that's the case, we're gonna get going tonight then. So part 2 of anatomy and physiology. If you guys weren't able to make part 1, Joe's gonna post that video so you guys can see it. That was more about cardiovascular, respiratory, all that stuff. This is gonna be the more complicated stuff. Yeah, the more stuff we deal with. Your book kind of goes into light detail of this stuff. It doesn't really go that in depth. If you guys go to college, especially in the medical field, you're gonna have to take AMP 1 and AMP 2, which is basically 2 semesters worth just on this. So we're covering this in 2 classes. Normally this goes over 2 semesters, which is about a year. So tonight, I adjusted the program's PowerPoint a little bit because there's some things it doesn't really go into detail about, and I want to make sure you guys understand it, especially the central nervous system. So we're going to talk about that. So some of this stuff on here is not in your book. I do suggest you take notes on it because it is part of the National Registry. So I'll kind of point that stuff out to you as we go through it. Before I jump into this, any issues with my Brady Lab? I know I talked to a few of you about it. Any issues taking tests or anything like that going on? Nothing? Everybody's able to access it. Right.
I'm still waiting for this one to kick over, so
Yeah.
it's something I did at work.
Right. Yeah, if it still is doing the same thing, send the email to Derek and Joe. They're kind of the gurus with the programming here. All right, we're gonna jump into it. So you guys already touched on life support chain, so I'm gonna pick up where Joe left off on the lymphatic system. So the lymphatic system, it's got multiple functions, primarily focused on removing pathogens, recognizing pathogens, fighting infections, and then eliminating those from our body. So I apologize. I have a ton of notes on my computer, so I'm going to be looking down here quite a bit. We got a lot to cover tonight. So in a nutshell, the lymphatic system, it's a network of nodes and vessels throughout the body that allow movement of the fluid lymph. So if you picture lymph, it's like kind of a thicker aqueous solution that just travels through our lymph vessels. So we know that we have arteries and veins, but we also have lymph vessels that basically secretes all our kind of bad debris through our body. So the lymph circulates through our body in a similar way that blood does by removing waste products and pathogens. So basically lymph squeezes through these vessels with muscle contraction. That muscle contraction pushes the lymph through our body, eventually making it to our kidneys to be removed, our digestive system to be removed from our body. It's a clear fluid. It's primarily derived from blood plasma. 90% of lymph is made up of blood plasma. So as things are removed from our blood, whether it's red blood cells, dead platelets, that kind of stuff, that all gets removed through our lymph system. So I'm going to get into kind of each structure here. So the main glands that I want you guys to focus on, we have the adenoids, the tonsils, spleen, thymus, and lymph nodes. So anatomically, this is where they're located. So your adenoids, they're internal to your tonsils. So anybody here ever gotten a tonsillectomy? Tonsils removed? If you have, they take your tonsils and they take your adenoids. They take them both. They sit right beside each other. And the main purpose of the adenoids and the tonsils is to basically fight off any pathogens that come in contact with our mouth, whether we breathe them in or we fluids, either way. That's kind of our first line defense with that, to fight those infections or prevent them from developing into infections. So complications with those, we'll get a little bit more into that during airway emergencies, but basically if anybody's ever had tonsillitis, painful, your tonsils basically swell up to the point where it can almost block your airway. They become huge. If you ever go to a call and you have somebody open their mouth, you can see their tonsils. That can be dangerous, it can be deadly, and that's why tonsillectomies are common, just to prevent that. It's not a crucial part of our immune system, it's a helpful part, but it won't make the difference of you living or dying. So the spleen, scroll down here real quick. So the spleen basically produces lymphocytes, which are white blood cells. You have T lymphocytes, B lymphocytes, monocytes, basophils, eosinophils. You don't have to know all that. But the main portion you need to know is that the spleen produces these lymphocytes, or white blood cells. So that becomes important. We need our white blood cells to fight off pathogens, fight off bacteria, viruses, fungus, any of that stuff. So our spleen's primary role is to hold those lymphocytes and then produce and release them as we're presented with infection. The spleen also kind of filters out and removes pathogens as they're destroyed. It also filters out damaged red blood cells. Certain disease processes, cancer, can damage red blood cells, and that's our spleen and our kidneys' role to kind of remove those blood cells. And then from that, we have the thymus. So the thymus, you can see, kind of sits anteriorly to the heart. So the thymus secretes hormones primarily for the endocrine system. We're going to talk about it a little more when we get to the endocrine system. The thymus's basic function is for metabolism, so growth, increasing our metabolism, increasing development. It takes an active role in developing our lymphocytes. So we produce or create lymphocytes. Now we need to mature them. To mature them, you have to expose them to an antigen, so a foreign invader. So I get infected with a cold virus. Our lymphocytes will then recognize that virus and place what's called an antigen. So that way it's basically like a little key or a red flag that's easily recognized by our lymphocytes to destroy it. So it can focus on those invaders. So it primarily works during our early years, so from early infancy to childhood. After that, it doesn't play as much of a role, but during infancy to childhood is when we're really developing our immune system. Prior to that, during our neonate phase, from basically birth to 6-month-old, that's when we rely on our mother's breast milk. Through the breast milk, infants will be able to take in different lymphocytes, different antibodies, so that way they can fight off infections early because they don't have a developed immune system. And then lastly, we have the lymph nodes. So it gets kind of confusing. Everybody says, oh, I can feel my glands. Lymph nodes are actually not glands. Glands are separate because glands produce hormones. Lymph nodes don't produce hormones. They're basically these little vessels that you can see throughout the lymphatic vessels. And their primary job is to hold T cells and B cells. So they just keep them kind of in reserve. As pathogens enter our body, they make their way into those lymph nodes, and then our T cells and B cells can recognize those pathogens and start an immune response. So whenever you feel your lymph nodes, you feel that they're swollen, it's because you were exposed to something, and they're doing their job to fight off whatever infection you were exposed to. Some people have permanent enlarged lymph nodes. That's actually a fairly common thing. There's multiple reasons behind that. It can be due to infection, cancer. I hate to use that term because it's not always cancer, but it is somewhat of a fairly common thing.
Does the enlargement of the lymph nodes mean that it's producing more T cells?
Yep.
and B cells?
Yep. And it's also taking in, because as they're killing off those pathogens, the byproducts of those pathogens are building up in our lymph system to be removed from our body.
Okay.
So that's the main purpose of that. Most common places that we can check for somebody's lymph nodes, underneath your neck, basically right under your jawbone. That's one of the most common spots. And then armpits as well. If you ever feel your armpits, your lymph nodes are swollen, doctors, that's one of the things they check whenever you go for a physical. They check your lymph nodes to make sure nothing's swollen. So that's a possible sign of an infection. So the primary function of the lymphatic system, number one, is fluid balance, regulating fluid volume in our extracellular space. So remember, it's filtering our blood plasma. Our blood plasma, if we're thinking of our arteries and veins, is what sits outside the red blood cells. So it regulates the volume of fluid in and outside of that extracellular space. 90% of blood plasma returns to circulation through our veins. So as it's being filtered, 90% of it goes back to their veins to be pumped by the heart to pick up more oxygen, and 10% of it throughout the day gets removed by our lymphatic system. And that's approximately 2 to 3 liters per day. Loss of the lymphatic system would ultimately result in death within a day. If you don't have a lymphatic system, then you don't have a way to fight off infections. So anything simple, like a simple bacteria or a simple cold virus, would kill you because you don't have a way to fight the infection. So the second component is our immune system. So our immune system, primarily the production of lymphocytes, which is T cells and B cells. You can take an immunology course to really understand the differentiation, the different types of T cells, different types of B cells, and their primary roles. It originates in the lymphatic system and come into contact with pathogens. So they sit in our lymphatic system. They wait for invaders to come in, whether it's bacteria, viruses, or fungus. Then they recognize that it's a foreign object, and it then goes into an immune response. The other portion of the immune system is to spread the remainder of body via the circulatory system to fight off infections. So if I've got an infection going on in my liver or spleen or lung, wherever, it's able to work as an access way to get our lymphocytes over to that specific site. So that way it can immediately fight off that infection before it spreads to other body systems. Kind of how the immune system works. Once you're exposed to a pathogen, so the lymphocytes recognize the pathogen and target it using antigens, like I explained. It's basically a molecule that's a key component of that pathogen. So for instance, let's say the coronavirus. What's one of the key components of the coronavirus? Spike protein. And that is the primary purpose of vaccines. So a vaccine, they say it's a dead form of the virus. It's actually not. It was a biomedical development to enable our immune system to recognize that spike protein. So that spike protein would actually be the antigen for the coronavirus. So if we're ever exposed to it, our immune system would then recognize it immediately. And that way it could start fighting off that infection before it spreads to our other body systems. That's the basic component of how our immune system recognizes those antigens. And then once it recognizes the antigen, it then sends in the killer T cells, monocytes, neutrophils, which are all just different lymphocytes, and it phagocytizes them. It's a term you want to know. Phagocytize means that it breaks that foreign invader down. So it penetrates either the bacteria or the virus, and it breaks it down, ultimately killing the virus So that way it can be removed from our body. That's pretty much that. So just one key thing I want to input here. So we avoid taking blood pressures on females, it can be males too, who undergo a mastectomy on a particular side. So if a female undergoes a mastectomy of the left breast, why would we want to avoid doing the blood pressure on the left arm?
Pressure into that area.
Every time we do a blood pressure on an extremity, we're actually building up the lymphatic pressure within that extremity.
It's the way you go.
Correct. On the affected side, yep. There is actually no physical research study to suggest that that can be detrimental, but they have shown that it is one of the results of a blood pressure. So as a standing precaution that we use right now, we try not to do blood pressures, IV access on the side of a mastectomy.
What's it called? The lifts to do? Push out, pass up.
So it basically builds up the pressure in that particular area of the lymphatic system. And as a result, basically that all pushes back into our circulatory system. So in that particular area, you'll have increased blood pressure, decreased perfusion. It basically just doesn't support the tissues in that area. So it makes it more difficult. In theory, there's been actual no proof to say that it is detrimental. So yeah, it basically increases lymphedema at the site of the blood pressure, but there's no official evidence to prove that it is detrimental to the patient. But as a precaution, don't do it if you can. There are females that have double mastectomies. In that case, it's a catch-22. You have to get a blood pressure somehow. There is availability to do a blood pressure via thigh cuff. You can, that's an option. If available, it's not a necessity. It's not saying you can't do the blood pressure on that side, but
Or you can do that other one. It's that first one.
yep, you can do, well, same thing,
Because of pressure.
right, of that extremity.
Is
So,
something you teach in advance?
Yep.
Okay. That's not an EMT type
to
situation.
do thigh cuff
Yeah.
blood pressures, yeah, you can do that.
Okay.
Yep, EMTs can do that. Yeah. So when we go over doing medical assessments and stuff, we'll teach you guys about doing thigh blood pressures. But that's just a general rule. So mastectomy, try to avoid that side. All right, the nervous system. So I'm going to touch on their PowerPoint real quick. I actually have my own separate PowerPoint for the nervous system that is a little better in detail about it. But in general, your major components of your nervous system incorporate your central nervous system and your peripheral nervous system. Can anybody tell me what your central nervous system is? What are the two key parts of your central nervous system? Brain and spinal cord. That, in a nutshell, is your central nervous system, is the brain and spinal cord. So anything outside of the brain and spinal cord is considered your peripheral nervous system. Okay, those are two things you're going to want to differentiate. So the central nervous system is made up of the brain and spinal cord. The peripheral nervous system, or the somatic nervous system, is made up of sensory nerves and motor nerves. Now, you also have a component of the peripheral nervous system, that's the autonomic nervous system, and that focuses on involuntary motor functions. So sympathetic versus parasympathetic responses. What's an example of an autonomic response?
Respiration.
Breathing. If we had to think every time to breathe, we wouldn't live very long. Same thing with our heart beating. To increase our heart rate or decrease our heart rate, that's an autonomic response. Okay? So this is a general chart of how the nervous system is broken down. I put this in here. This isn't in your book. So if you want to make this flow chart in your notes, by all means, go for it. So you have your nervous system that then breaks down into your peripheral nervous system and your central nervous system. Your central nervous system stops there. There's no breakdown from that component. However, your peripheral nervous system breaks down into your autonomic and somatic nervous system. So your autonomic nervous system, which is the part of the nervous system that we don't think about, it happens automatically. That breaks down into a sympathetic nervous system and our parasympathetic nervous system, or what we call a sympathetic response or parasympathetic response. Anybody in here know the difference between the two? If you don't worry about it.
Between sympathetic and parasympathetic?
Yep.
I could be wrong. Is it one fight or flight and the other one's rest and digest?
Yes. You know which is which?
Sympathetic fight or flight, right?
Yep.
And then parasympathetic rest and digest.
Yep. So that's a perfect term for you guys to remember. A sympathetic response is our fight or flight response. So with a fight or flight response, our adrenal glands release epinephrine. So it increases our heart rate, dilates our pupils, increases our respiratory rate. And that's all in response to something that stimulated us to get excited. So the example we use, if a bear is attacking you, your sympathetic nervous system is going to respond because you're going to want to run away. So in order to run away, you need to increase your heart rate, increase your respiratory rate, so you can run away from the bear.
You're not supposed to run away from the bear.
Well, depends what kind of bear.
Care bear, yes. If it's a grizzly
Right.
bear.
Yeah, pretty much. So our parasympathetic nervous system does the opposite. Our parasympathetic nervous system is the rest or digest component. So it decreases everything, lowers our heart rate, pupillary constriction, decreases our respiratory rate, decreases our blood pressure. So we say rest and digest after you eat a big meal, especially after Thanksgiving dinner. One thing you want to do, go to sleep, take a nap. That's your parasympathetic nervous system kicking in. It's allowing your body to increase its metabolism so it can break down food. Any animal out in the world after it eats a meal typically wants to take a nap, and that's because of the parasympathetic response. Certain drugs can act on these two things. The most common we see for a parasympathetic response is opioids. Opioids decrease our heart rate, they decrease our respiratory rate, and they decrease our blood pressure. And then sympathetic wise, cocaine. Cocaine increases our heart rate, causes arrhythmias, increases our brain function, and it increases our respiratory rate. So, go ahead.
Aren't those also like A parent, E parent? Don't those fit into one side and the other?
I get into that. That's good though. Our somatic nervous system. So this is our portion of the nervous system where we actually voluntarily think about it. I'm thinking of moving my arm. I'm thinking of running down the road. It takes an actual thought or process to move your extremity. So our somatic nervous system works off of two values. One is sensory input. So I touch something, the surface is cold or hot. My brain, my nerves are recognizing that it's either cold or hot, and it's sending a signal to my brain to tell me it's cold or hot. Now, if it's causing pain, then my brain responds to say, hey, take your hand off of that surface because it's burning you. So it travels up in an afferent fashion to our brain, and then it travels down our nervous system in an efferent motion to remove our extremity. Does that make sense? I have a couple pictures that break it down a little better. So this is kind of what you were talking about with afferent and efferent. So to see how our peripheral nervous system works, we have a sensation. Our sensory receptor of our nerves recognize it, sends the signal to our spinal cord, which then takes that input, either sends it to our brain, or if we need to remove our extremity right away, it does a short reflex pathway to remove our hand right away because of that pain sensor. And then this is basically just how it travels through the spinal cord to send the signal up to our brain and back down. So if we go to a trauma patient, why would this be important? Why do we do a neurological assessment?
The spinal cord, any possibility of no feelings, motor movement.
Yep.
All of those are not going to
TBIs.
show.
TBIs, that's why we do cervical collars. So when we do a neuromotor test or a neurosensation test, that's what we're looking for. We're trying to track all the way down their spinal cord to make sure that their spinal cord is intact. If we find anything abnormal, then we're taking spinal precautions, exactly. So that's why we do that stuff. Our cervical spine plays a big role in our respiratory drive. So C1 through 4 keep you alive. So if there's any injury in that site, that can shut off your respiratory drive. Actually, I had a patient who had that when I was working in the ER. They had a C2 cervical fracture. We didn't know it. And she turned her head to the side and she stopped breathing. She became unresponsive, stopped breathing. We put her in a cervical collar, kept her head in line, and she woke up and started breathing again. So that's why we do cervical collars. You want to prevent damage, further damage. So the peripheral nervous system, we've kind of already said this, 2 subdivisions, the autonomic and somatic. So involuntary versus voluntary. Just know the difference between those two. And then I'm going to go to my slide real quick. If I can get it to work. And we're going to start from there. Wonderful. Okay. So now that we kind of understand the central nervous system and the peripheral nervous system, we got to talk about the brain real quick. So there are different layers within our head. The most outer layer is our scalp. Our scalp is our skin. That's where we have hair, different glands, sweat glands that basically protect us. Then below that, we have our skull bone. Below our skull, we have venous blood. Part of that venous blood in that space is the it's kind of part of the dura mater. Below the dura mater, we have the arachnoid matter. And below the arachnoid matter, we have the subarachnoid space. So the subarachnoid space is a little cushioned space that contains cerebral spinal fluid to cushion our brain from our skull. So if somebody spontaneously develops a bleed on the surface of their brain, it's called a subarachnoid hemorrhage. As that hemorrhage develops and builds, it's going to push against our brain and it's going to kill brain tissue. So a classic example of this, anybody here ever had a concussion? What's a concussion? Bruised brain.
So I couldn't walk or I felt like this, literally. I felt it.
Yep.
Like Wolfland.
Yep. Yep, that absolutely will cause a concussion. Sports injuries are common with that. So when our brain hits against basically the surface of our skull, that can cause a bruise, basically a brain bruise. And with that, you'll have side effects roughly lasting a week or longer, depending how bad it is. So anytime we go to a car accident, we take that into account. When you think about all of the forces involved, because our brain is sitting in that space and it can move around. So something you want to consider anytime you go to a trauma.
Part of the reason why shaking babies and so bad on this.
Yep. Yep.
Actually happened. It actually happened when I was like 4 months old. So they
Oh,
did it, like, the shock and everything. I mean, it's still in there, but it's not done before.
Yep.
But yeah, they put the shock and like drain the spinal fluid or
Yep.
whatever.
Yeah, no, definitely. That'll increase your cerebral spinal fluid, which will push against your brain. And that can kill brain tissue. So that's just basically, in a nutshell, the surface of our skull and our brain. If you look interiorly into our brain, it's broken down into different segments, which you'll see here. So this is the different components of our brain and what roles those components place. So if you look at number 1, which is the back of our head. That's our occipital lobe. Our occipital lobe plays a role in our vision. And it kind of works inversely. So the back right portion of my head is actually the vision of my left eye, and vice versa. My right eye is part of the left posterior region of my occipital lobe. So if we have somebody who says they suddenly develop blindness in one eye, it could be from a stroke or a TIA, and we can recognize that it may be ongoing in that region of their head. Same thing with trauma. Our temporal lobe, that's focused more on short-term memory, equilibrium, emotions, and you can see it, number 2. It's right on the sides. A lot of GSWs we go to, typically in the temporal region. Equilibrium, everybody know what that is? Balance. Yep. So that's the main component of that.
Sorry, is that in your ears?
Your ears play a role in that as well, if you're thinking like vertigo.
Yes, yeah.
So our temporal lobe, you'll actually notice it sits right next to our ears, right? So our internal ear, so our cochlea, actually is directly connected right to our temporal lobe, and that's where that comes from. That's why you can develop that. Our parietal lobe, which is number 9, it's the back portion if you were to split our brain. That plays a big important role. That's our sensory cortex. So it's our main area for sensory input. It includes our somatosensory area, so sensation of weight, texture, temperature. Our Wernicke's area, which is our speech and language. Our auditory for hearing, and our olfactory for smell. You do not have to know all that stuff, just so you can see how the brain works. So that's all focused more on sensory input. Number 13 is our frontal lobe. So at our forehead, that's kind of our high mental function area. That's where our judgment comes from. Our concentration, our emotions, our expressions, our planning, that all comes from the front region of our head. It includes the cerebral cortex, so eye movement and orientation, and our Broca's area, which is number 4, still part of our frontal lobe, and that's voluntary muscles for speech. And then number 14 is our cerebellum. So that's actually the back portion back here. So our cerebellum focuses on fine motor control, balance, and equilibrium. So when you're writing, scrolling your mouse, anything like that, that's all fine motor control. If we go to somebody and we notice that they're unbalanced, they can't, tremors, that kind of stuff, they're lacking fine motor control, that's an impairment of their cerebellum. Any questions on that? So in our central nervous system, we have something called decussation, which is the crossing of the nerve fibers from one side of the central nervous system to the other. So kind of like how our vision changes. So from our right posterior occipital lobe takes in information from my left eye, that's decussation. So the same thing, if I'm feeling numbness in my left arm, it could be something due to the right side of my brain. So that's why when we do a stroke exam, I'm noticing left-sided paralysis. That means they're more than likely having a stroke on the right side of their brain. Does that make sense? Just information to know in the field, doesn't really make a difference to us, but just information you can take.
So when you say the crossing of from one side of the central nervous system to the other, you're talking about from the brain to
Distal.
everything else?
Yep.
Okay.
Yep, exactly. And that occurs typically just below, let me go back. This picture. So these guys right here, yeah, that's a pretty decent picture of it. So our brain stem. So we have multiple nerves within that brain stem. We have our pons, our medulla oblongata, if anybody's watched Waterboy.
No, but you're wrong. Mom was right.
That's right. So that's where our medulla oblongata is. It's actually right just below our brainstem. It's actually part of our brainstem. So the decussation actually occurs just distally to that, so just below that. You don't have to know what the pons is, what the medulla oblongata is, or any of that stuff. That's more of an advanced level thing, but just know where they are. Any questions with decussation? That's decussation in a nutshell. All right. And that just gets into strokes. See that component another day. Slide. Perfect. Okay, so we talked about that. Any questions on the nervous system before I move on from that? Nervous system is kind of a big component in what we do in EMS, especially if you're recognizing neurological shock or neurogenic shock, strokes, all that stuff has to do with our nervous system. So as we get into those emergencies, you'll kind of see how that role comes into play. But just understanding the general structure and function of them is the most important part. Digestive system. So the digestive system, primary role is digestion. So the breakdown of food products into molecules that we can use and turn into energy. So it provides the mechanisms by which food travels through the body and is digested. It's broken up into upper digestive system or upper GI and lower digestive system, lower GI. So they mainly point out the stomach, small intestine, large intestine. We actually have, and I'll get into it a little bit, accessory organs like the liver, the gallbladder, spleen. Those all play a role as well in our digestive system. So our accessory organs, you can see these here. Let me just make sure I have this. Nope, okay. So we'll talk about the accessory organs first. So number one, where's our liver sit? Right upper quadrant. Okay. Anytime we go to somebody with abdominal pain, you better be assessing the abdomen. If they're explaining that they have right upper quadrant abdominal pain, we're thinking liver. Okay. If you go to somebody that's yellow as yellow as the lid of her cup. Anybody ever seen somebody like that?
Mm-hmm.
Yep. So what is that called? What is that symptom called if they're yellow? Jaundice. Yep.
My brother-in-law, they gave him a liver transplant. His like,
Oh yeah.
He was so yellow. It was like.
Yep. So that's a symptom that we see in liver failure. The other thing we see in liver failure is ascites. That's basically an enlarged abdomen, and that's just due to fluid building up in the abdomen because the liver isn't filtering anything out.
Can they bring that? I mean,
yep. They can. It's called a paracentesis. So it's basically just a big needle that goes into their abdomen. They remove the needle, and what's left inside is a catheter, and they remove that out. They can take from 10 liters of fluid all the way up to 30 liters of fluid.
That we get rebuilding it?
Oh, yeah. All right, do you mean they're going to add fluid back in?
No, I mean, would it, after they remove fluid, would they rebuild again on the inside?
Yep.
Wow.
Unless the liver failure is fixed, it's just going to keep going it and get worse. Yeah.
He said it happened like for 13 days.
Yep.
His stomach was
Oh, yeah. Rock hard.
rock hard and big, yeah.
Yeah, that's basically end-stage liver failure. Tough to fight. So our liver.
Would the liver transplant fix that, or would it be like kind of beyond?
It would. It would fix that. The hard part is it's tough to be a candidate for a liver transplant. There's certain criteria that actually will exclude you from being able to get a liver. Alcohol dependence is one of them. If you have any history of alcoholism, you're not on the list.
But they're not gonna go to anyone if there's been
Mhm.
Pretty much.
That's in theory.
Exactly.
someone else is really going.
Same thing with somebody who's suicidal and takes too much Tylenol. So they try to kill themselves with Tylenol. Tylenol shuts down your liver. It is one of the most detrimental things to our liver is Tylenol. It's great for pain management in normal quantities, but if you take too much of it, it will kill your liver. So somebody attempts suicide with Tylenol and they need a liver transplant. Won't be it.
My ex-brother-in-law, he didn't even make the list, but he went to get blood surgery or something, and doctor, they opened him up and they moved him around top of the list.
Yep.
And then he got a new one, well, youth, whatever. Anyways, like 6 months later. Newly him, yeah. He was, 6 months later, he went back to drinking. And it's sad.
That's
I mean, it really
unfortunate.
was.
Yeah. So yeah.
That's nothing needed.
Yep. I mean, there's certain pathogens that can cause liver failure. Anybody think of them? What pathogen can cause liver failure?
Yep.
Hepatitis. Hep A, Hep B, Hep C. Those can cause liver failure. That's why we get vaccines for them. So we've got a bunch of notes on the liver here, sorry. So number one, any guess as to how much blood the liver holds? Any deer hunters in here? Pretty close.
Half a liter.
A pint. 13% of our blood volume is in our liver. So anybody's ever shot a deer, hit them in the liver, they don't go very far because there's so much, it's so vascular and there's so much blood that just sits in our liver. Yeah, you did. Well, some people eat the liver.
Yeah.
I know.
It's like the rest.
Yeah. The other part about the liver, from our perspective, oh yeah, that really ruined it. If we go to a trauma, multi-system trauma, and they have a liver lac, that can be detrimental. Liver lacs are actually graded, grade 1, grade 2, grade 3, depending how bad it is and how severe it is. And that's something we look for. If I see bruising in the abdomen right in that area, that's a huge red flag for me. That's saying we may have a potential liver lac, and that patient could bleed out just from that liver lac. Yep. Yep, exactly. I know. Shorthand terms. Yeah, if I say lac, it means laceration.
Yeah, I had one like that, but there was no symptoms other than it was very sketchy.
Yep.
And they,
Yep. So we call that a rigid abdomen. So when we're palpating the abdomen, we're looking for point tenderness. We're looking for rigidity, whether it's a soft or rigid abdomen. We're listening to bowel sounds, make sure there's good bowel sounds in all fields. Contusions. Anybody know the terms for the different types of contusions in the abdomen? It's called, one is a Cullen's sign. A Cullen's sign is when you develop a contusion around your umbilicus, or just above your belly button. And the other, anybody think of the other one? So it's when you develop a contusion on your right side. I'm blanking on the name of it right now. I know, Cullen's, and I'll think of it. It'll come back to me.
But just as far as the rigid abdomen thing, you'll feel that it's not just like juice yolk, it's very different. It's like,
Yep.
you're like, why is the abdomen like this? Like,
Yep.
so it's not, you got to do 6 pack abs.
Right. You'll notice a difference between muscle and just a really hard abdomen. So yeah, the liver holds 1 pint of blood, 13% of our body's blood volume. The liver has over 500 functions for our body system. I'm not going over all 500. I'm going to touch on the main important ones that you need to know. So one primary function is the production of bile to break down fats and carry away waste products in the small intestine. So the production of bile, production of proteins from blood plasma. We need protein for muscle development. Production of cholesterol to carry fats through the body. So if we eat fatty foods, we need something to carry those fats through our system so we can digest it and get rid of it. Conversion of glucose to glycogen for storage. We're going to touch more on that when we do diabetic emergencies. We need glucose in our body. What is glucose for us? It is sugar. What does it do for us? Energy. We need glucose for energy. I just went to a diabetic emergency last night, and the individual's blood sugar was 35. He was unresponsive, pale, diaphoretic, in a comatose state. We gave him sugar, he woke up. You can't function without sugar. If you don't have sugar in your body, it'll kill you. So the liver comes into that component because it stores glycogen. So if our body's recognizing that we have enough glucose circulating around in our system, then it'll take that extra glucose and store it in our liver. So that way, if we're during a famine phase where we haven't eaten in a while, we need to get glucose from somewhere. Glycogen. I write that up here.
So it's the storage space for glucose.
Yep. It turns glucose into glycogen, and then the glycogen gets stored into our liver. It also functions to convert that glycogen back into glucose. So if our body's recognizing that I don't have enough glucose to keep things going, then I need to turn that glycogen back into glucose, and it'll do that. We give a medication called glucagon. Anybody's ever heard of that? Glucagon is the enzyme that tells our liver to convert that glycogen back into glucose. So one of the caveats of that medication we give, they have to have a functional liver. If they don't have a functional liver, it's not going to do a damn thing. So when you work on the ambulance, you'll see that in one of your bags. We carry that. Just some other things. It processes hemoglobin to carry oxygen on our red blood cells. So you need hemoglobin in order to carry oxygen. Joe talked about that a little bit. It clears the blood of poisons, drugs, and foreign substances, and it removes bilirubin from the blood to prevent the development of jaundice. So when you see somebody with jaundice, that's the buildup of bilirubin. That's why they turn that color. Aside from the liver, we have the gallbladder, which actually sits just beneath the liver. Any bear hunters, that's a big thing. Bear gallbladders, it goes for big money. It's illegal to sell it, but it goes for big money. So the gallbladder.
Just sorry, go back to the down person.
Great Turner's, thank you. Great Turner's sign.
And Great Turner's sign refers to bruising of the flanks and may occur in conjunction with onset, especially patients with retroperitoneal. That one I didn't know. How large a bruise was?
It could be the whole side. Yeah, definitely. It can be difficult in car accidents to kind of differentiate, is that from the seatbelt or is that from an impact into the abdomen that's causing the bruising? You'll typically notice it. When we get into trauma, we're going to show you some pictures of what that looks like, and when you see it for the first time, you'll know. So yeah, the gallbladder. Gallbladder doesn't do much of anything really. Its primary role is to serve as a reservoir for storage of bile for the liver when digestion is not occurring. So the liver produces bile. If digestion is not going on, then it's going to take that bile and store it in the gallbladder. Where that can go wrong, anybody ever heard of gallstones? Gallstones, right? So gallstones occur when there's excess cholesterol, bilirubin, or bile salts. So it basically alters the chemical composition of that bile within the gallbladder, and it turns it into a stone-like structure. Very painful. Moving on, we have the pancreas. So the pancreas sits more in our left upper quadrant. So when we're palpating the abdomen, right upper quadrant, liver, left upper quadrant, pancreas, spleen. Those are those main areas. So the pancreas produces enzymes to break down fats, proteins, and carbs into our intestines. It also produces one key hormone to our life function, insulin. Anybody with a history of type 1 diabetes, that's development from their pancreas not producing any insulin. So you can have, what's that? Type 1? So you usually have to go on an insulin pump or insulin injections. And the reason for that, you can have circulating glucose in your system, right? our muscles, our tissues aren't just going to automatically take that glucose up. Insulin works as the key holder. So insulin binds to our cell, opening the gate to allow that glucose to go into our cell and be used for energy. That's why we need insulin.
Are pancreas transplants a thing? Just out of curiosity.
I don't believe so. Pancreas resections are, so that you can cut off portions of your pancreas and still be fine.
I was just curious about the kind of like
No.
an option to not necessarily cure diabetes, but so it's
Right. Dependent on it, yeah. No, unfortunately, it's not a procedure that they can do. It doesn't work like that. That's why you have to go on. If you have type 1 diabetes or develop later onset type 2 diabetes, you have to go on insulin, those kind of drugs. So, but it's manageable. So insulin is something that can be produced and given as a medication if it's not working. So any questions on any of those things? I didn't talk about the appendix. Anybody guess why?
Because you don't have one.
I do have one.
Possibly lymph node.
So where does anybody guess where our appendix sits?
Right. Lower quadrant.
Right lower quadrant. What does it do?
We don't know.
As of today, we believe it does nothing. There is belief that it actually served a purpose during human evolution to break down raw meats. So there is a thought that it actually produced an enzyme to break down raw meat, because during that time period, that's what was done. Cooking wasn't a thing. But nowadays, everything's cooked. There's no purpose to our appendix. Anybody's ever experienced appendicitis? Basically, that appendix can become inflamed and it can actually burst. Yep. So if you develop appendicitis, they'll actually go in and just take it out. So it's kind of a useless organ, but it's there.
The appendix actually does, it says here that it like has a store of good bacteria. So if you ever get a bacterial infection with antibiotics, it has a small function. It gives you store of bacteria.
Yeah.
Is that what they consider a lymph node?
Not kind of, not really, because throughout our entire colon, there's good bacteria. But if you ever go on antibiotics are broad spectrum. They kill basically all bacteria, including our good bacteria. So from what Ro was saying, it's kind of helpful to have that bacteria in storage in the event. So that way you don't have bad bacteria invading your good bacteria. So going into the upper digestive system, upper GI. Starting from the top, we have our mouth. Our mouth has salivary glands that produce saliva when we smell food. So you get the smell of Taco Bell, you start producing saliva, and that's an instantaneous response. That's an autonomic response. And the purpose of that, saliva is used to mix with our food when we chew it up. So that way it can begin breaking down that food into usable components. So digestion occurs as soon as we put something in our mouth. It starts breaking down that food. Our teeth are used to chew up the food into smaller pieces so it can be more easily digested. As food travels down our mouth, it goes into our esophagus. So at the top of our esophagus is the epiglottis, which is a little flap that folds over our trachea. Every time you swallow, your epiglottis moves. Every time. If it doesn't move, then stuff's going into your lungs, and that's bad. So just think of our esophagus. We have the epiglottis, folds over our trachea every time you swallow. We have muscles around our esophagus that contract to keep pushing food down so it doesn't come up. If we vomit, then it's coming up. It's just the motion of the muscles. We have a sphincter at the end of our esophagus that opens up to allow food to go into our stomach and prevent gastric juices from coming back up. Anybody ever experienced acid reflux? Sucks. So acid reflux is actually the occurrence of gastric acids and enzymes coming up through that sphincter, and that causes that burning sensation coming from our esophagus. Down from that, still part of the upper GI system, we have the stomach. The stomach is a hollow organ that holds food during digestion, and mixes that food with enzymes and acids. The stomach has a strong acids, typically it's hydrochloric acid, that breaks down food until it's able to be passed into the small intestine. So you have a solid food, you chew it up, your stomach enzymes start to break it down until it becomes basically a liquid component, and then it'll pass through into our small intestine. So at the top of our stomach, we have the esophageal sphincter to prevent food from coming back up. And at the bottom of our stomach, we have the pyloric sphincter, which prevents undigested food from passing through into our small intestine. So it's basically a valve on both ends. The lower digestive system. So this is when we separate the upper from the lower. The lower digestive system includes our small intestine. So our small intestine, which is the longer intestine, the small intestine and the large intestine? Small intestine. You had 50-50. So the small intestine is actually 15 to 20 feet in length. The large intestine is about 5 feet in length. So the small intestine, 90% of our digestion and absorption occurs in the small intestine, and 80% of our water that's absorbed occurs in the small intestine. It provides a chemical breakdown of foods into minerals and through enzymes and acids, and those minerals can be used for key cellular processes, including potassium, chloride, sodium, glucose. Those are all things that can be broken down into different byproducts in our small intestine. Our large intestine, that's primary function is to reabsorb any excess water that our small intestine didn't get a chance to absorb. And it also absorbs small minerals and ions like sodium and chloride. So basically anything that didn't get absorbed by the small intestine, the large intestine will pick it up. It also forms and temporarily stores feces. So that's where feces is developed. And then it also maintains a healthy culture of bacteria. I have a picture of it. No, not. One thing I wanted to point out about the large intestine. So the large intestine is broken down into different segments. So if we're looking at this segment here, so that would be my right side of my body, that is called the ascending large intestine, the ascending colon. Then when we move sideways across the abdomen, that's called the transverse colon. And then when we move downwards, that's the descending colon. So if you just think about how food travels, it ascends, transverse, moving sideways, and descends. From there, it moves down into the cecum, to our sigmoid colon, and then to our rectum, and then our anus. So that's how food travels through our body. You'll notice that the large intestine has these kind of little outpouching structures. So these things here, wish this looked on TV. It's not. So those little outpouches are called diverticulum. Anybody ever known of anybody that gets diagnosed with diverticulitis? That's what that is. So one of those outpouches becomes infected. It can cause severe pain, can cause bleeding, and that is diverticulitis. Make sense? Typically how those become infected, bowel obstructions. So feces gets blocked up in one of those outpouches. Bacteria start to invade that area, and then that can cause an infection. So that's diverticulitis.
So if somebody tells you that.
That's exactly what it is. Yep. So it's just an infection of that area, the diverticulum. It's super painful. They have to go on antibiotics and all that stuff. And they can develop a GI bleed from it. Any questions on the digestive system before I move on from it? Doing really well. Perfect. We may be out early tonight. Okay. So the integumentary system. Anybody know what the integumentary system is? Skin. Your skin is your integumentary system. So your skin has multiple functions. It works as a form of physical protection. How does it provide physical protection?
Dirt out the infection type material and stuff like that.
Keep stuff from entering our body, right? So to this day, all of us sitting here, we have trillions of microorganisms sitting on our skin right now.
Largest organ.
It is. Integumentary system is the largest organ of the body. So we're exposed to trillions of microorganisms every day. They're sitting on us right now, but they're not causing an infection on us. And that's because of our skin. Our skin prevents those microorganisms from entering our body. Now, if you get a cut, and what's that? It can become compromised. And that's where we rely on our immune system to prevent any further development of infection and invading any pathogens that enter through. That's why anytime we go to somebody who's got a laceration, partial amputation, what have you, we cover it with a sterile gauze. So that absolutely, burns are bad. Burns are bad all the way around because that really affects your cardiovascular system. It affects your lymphatic system. It affects your respiratory system, and mostly your integumentary system. So with a burn victim, they're at high risk for infection. And yep, 80% of burn victims don't actually die from the burn. They die from the infection later on.
That's why a lot of the times, like, don't they, at hospitals, don't they put them into like a coma so they can.
Yeah, sometimes. Usually they'll sedate them more if they're for the transport purposes, because usually they get flighted. Yep, yeah. It's actually our protocol in the state of Vermont for burn victims is to double our pain management. So normally I give somebody, let's say I give them 100 mics of fentanyl, the burn victim, I'm giving them 200. It's severely painful.
We went to a call last year with a lady, she had no feelings in her legs, period. She got burned on her legs.
Yep.
And she was still feeling pain.
Oh yeah.
Of grease, man. She
Yep.
had a full part of grease on her.
No, it's super painful. Even going with burns, so our skin works to keep our fluids, water balance inside our body. So it's not just actively being excreted out. And at the same time, it keeps water from entering our body. With a burn, you lose that ability. One of the most common things we see with burn victims is a massive excretion of fluids out of the site of the burn. So fluid loss, that's why we double our fluid volume with burn victims. So they have massive fluid loss.
I got party and Pacific Beach, California. These have these big concrete rings.
Mhm.
And some guy came up behind me, accidentally pushed me.
Yep.
By accident, and my legs right there. This thing. It's like, thing is, I didn't really feel it for about the first half an hour, 45 minutes, and then
Then it hit.
the world lit up. And
Yep.
they had to take me, it's like mostly second degree burns, but then I had a couple of charges. That.
Yep.
Hit her.
Yep.
That
Yeah,
was
when
most-
we
I
get
didn't think
into-
it did hurt before, but that was probably the most painful. Because there's nothing you can do about
The
it.
second
Right.
degree hurts you more than the first degree.
There's nothing you can do. about it.
Usually. So
Usually
first degree is a sunburn.
dead. It kills everything, right?
So first degree is basically a sunburn. It's just the superficial layer of our skin. Yep. Second degree is a partial thickness burn. So that's when it goes
Blistering.
down to the superficial space. It can get into our muscle tissue. And then third degree is a full thickness burn. Full thickness burns, you don't feel them at all.
Just right around.
So third degree burns, they don't feel it because they burnt off all the nerve endings.
Second
Right.
degree.
Is that where a skin graft would have to be?
Yep.
My aunt in Vegas, what made her do this, but she took off the radiator cap.
Yep.
And
Exploded.
yeah, burned all the shoulder or arm.
Yep.
And she's had to get several skin grafts.
Yep.
Like she's doing okay, but she's like,
Yeah, because you need some form of barrier. That's why they do skin grafts for burn victims, because you need some kind of barrier to protect you
yeah, the thing that
from infection. Mhm.
back to her leg.
Yep.
They put up there.
Oh, yeah, absolutely.
It really sucks.
Yeah. And the unfortunate part about burns, once you exceed 50% burn coverage, so we're gonna go over how you measure burn coverage, rule of nines. Yep, you have the rule of hands, rule of nines. Especially when we get into pediatrics, like it's kind of difficult knowing burn coverage. And once you exceed 50% of burn area, mortality rates increase to over 90%. 50%. So if I burn 50% of my body, my chances of survival are basically less than 5%.
Possible.
It is possible. Get lucky, but very risky. So does anybody know where our closest burn unit is? Boston has one. Small burn. UVM has a very small burn unit. No. So UVM does have a burn unit, but they do not take complicated burn cases. So any complicated burn case goes to Boston. They fly it down. Yep. So.
Well, usually it's something that traumatic, not big of an issue that's flying down and straight to Boston.
Yeah, Boston's geared for that. They have a whole unit in their hospital that is just designated to burns. I'll give you my case. I had the worst burn I ever had was an individual who was trying to light a bonfire, and he was spraying. He had a 5-gallon, basically bucket, and he was dumping kerosene on it. Anybody knows the work of fire, the fumes are what ignited. So, and the wind was blowing back at him. So all the fumes were going towards him. He lit a match and it engulfed him. He lost basically pretty much all of his skin from his head down to his abdomen. So it burnt the shirt right off of him and everything. I don't believe he survived. Pretty confident he didn't. But yeah, that's the kind of stuff you go to.
Yeah.
Yay. It does, it happens. Not always that bad. So, all right, getting back to the integumentary system. So primary functions, we already talked about protection. It's a physical barrier protecting us from foreign invaders. Water balance, that basically just prevents excessive loss of fluids, loss of water from our internal systems exteriorly and vice versa. If I go jump in a pool, I'm not just going to suddenly swell up with water. My skin's going to prevent water from entering my body. Temperature regulation. This is a big one when we talk about hypothermia and hyperthermia. How does our skin play a role in regulating our temperature?
Blood supply.
Bingo. Blood supply. So if I'm feeling hot and I need to lose heat, how does my skin react to lose heat? Sweats one. One more. Talk about blood supply.
Blood goes to the shunts of the surface.
Won't shunt.
No.
Nope. So our veins, our superficial veins, those will all dilate and increase blood supply to our distal extremities. And the purpose of that is to try and release heat. So through radiation, we increase our blood supply. That radiation, our heat loss will increase, try and cool us down. What about if I'm feeling really cold, shivering?
That's what
It's gonna shunt.
Australia's already working goosebumps and everything.
Yep. So that's your body shunting. You'll notice that your capillaries, your veins will start to constrict. It'll reduce blood supply to your distal extremities and preserve it towards your core as you go down colder and colder temperatures. So that blood supply sits in our skin. And that's why you'll see somebody with cyanosis or cold mottled fingers, because it's shunting the blood supply to those distal extremities.
It's kind of like why, I mean, this is a really small example, but it's kind of like why in a cold, if you wear like a ring, it falls right off and vice versa.
Yep. Yep, absolutely.
If you are experiencing hypothermia in the bloodstream, are you more likely to also get frostbite because of lack of blood supply?
Absolutely. Yeah, it depends. There's a lot of factors that go into it. How cold the temperature is, how long you were exposed to it, were you wet or dry, that kind of stuff. We do a hypothermia discussion later on once we get into that stuff. But yeah, hypothermia is very difficult to treat, especially when you get so cold. Once you get down to like 85 degrees core temperature, that's when your heart really gets unhappy and you can go into cardiac arrest.
Got real bad in the back poles, got wet.
Yep.
Ski, we were still wearing a sweatshirt, sweatpants, and it was probably 10 degrees that day. He
That's
got
smart.
lost for a while, and by the time he got down, he was altered mental status, he was
Yep.
taking his clothes off. He was sitting next to the side of the road. Luckily, a van came by, saw him, brought him to us.
He was taking his clothes off?
Yep.
His core temp was 87 degrees.
He was cold. Yeah, he was shivering. We put hot packs under his arms, into his groin, covered him up, and it took a while,
Yeah.
a couple hours, but he came back. Yeah.
So there's actually different symptoms that develop at different stages with our core temperature. One of the stages when we develop altered mental status, typically when we hit that 87 degree mark, one of the more common symptoms is actually the decision to remove our clothes.
He's lucky.
Don't know. You're altered, your body's basically doing anything it can to try and generate heat, and it's not thinking appropriately. So the thought process is that my clothes are cold, I'm gonna take them off. But you lose your heat. So yeah, temperature regulation. Big part of our skin. Excretion. So our skin excretes salt, excess water that's released through our skin. So sweat glands, if we get really hot, we release sweat, which consists of salt and water. What is the purpose of sweat? What does sweat do? How does it cool down the body? Evaporation. So that sweat that's on our surface is holding heat. As it evaporates, it removes heat. What about convection? Convection?
Oh, getting hit by warm air. Yeah, that'll blow it off of you. You won't even notice it. Like drier temperatures out west is more of a problem because you don't realize you're sweating.
Yep.
It just goes off you so quickly, so you have to just keep drinking.
Yep. You develop
Not so much
dehydration
here.
really
It's
easy.
the opposite here.
Yeah,
So
we're in
bad.
a humid environment here, especially Florida.
Urinary output. You're gonna urinate more. Hot environments like that.
Yep. Oh, definitely.
Yeah.
Yep. That's why it's so easy to develop dehydration down there, because you don't even recognize it. You don't know what's going on.
No, I was gonna say, now isn't drinking too much water bad sometimes?
So that is a thing. Drinking too much water to the point where you completely dilute your blood plasma, and you're not able to basically put oxygen onto your hemoglobin and perfuse your tissues. You have to drink a lot of water. I think the average adult that experiences that is close to 6 gallons of water in a very short period of time. You can drink 6 gallons of water.
Drink 6 gallons of water.
I bet for $100.
Yeah. I usually don't take around themselves.
Pretty much. It's not a common thing. It is a thing though, but it's just not very common.
You would think after like the first gallon, he's so
It's basically just, there was a lawsuit, it was like a ministry or something, and one of the things that one of the individuals has to do was drink a lot of water, and he actually died from water poisoning. That's the only case I can think of. I've heard of it.
Now, somebody heard it, I don't remember who I heard it, but someone drank water, a lot of water, they're hot, and then at night they kept drinking water, and then like they drowned themselves.
Mhm.
Is that possible?
Right, drowning?
So if you develop so much fluid in your vasculature, you're not peeing it out, your fluid's got to go somewhere. And a perfect example would be congestive heart failure. Our heart's not pumping effectively and fluid can back up because of it. The fluid's got to go somewhere, and it goes to our lung cavity.
So
That's
it's kind
why.
of like if you drown or basically drown, you have to get resuscitated at a pool. a lot of times they look out for secondary drowning because their lungs have too much water in them. So they
Yep.
can still drown again, even though you brought them back and pulled them out of the water.
Right.
already. So that's what I feel
Yep.
like.
Yeah, drownings are complicated too. Positive pressure, those forcing air through their lungs. Good question though. So that's excretion, and then the last thing, shock. So that's more about the impact. So if I get punched in the abdomen, that force is not going to go through my liver. It works to basically absorb that force, protecting my vital organs inside to a point. That's one of the things it does. So we're going to talk about the different layers of the skin. So you have the epidermis, dermis, and subcutaneous layer. Especially when we get into burns, you need to know this because you'll have to be able to identify what's involved with a 1st degree, 2nd degree, and 3rd degree burn. So know these layers. So the very outermost layer of our skin is our epidermis. It's basically made of skin cells that are developing, pushing to the surface, and on the very outer portion of our skin is actually dead skin cells. So they're actively pushed up every time. Anybody know off the top of their head how often we regenerate skin cells?
Every 7 years. Or no,
Nope.
every day.
Huh,
Every day.
every day. Yep. There is something that regenerates every 7 years. Your liver. So every 7 years, you basically have a new liver.
And it's not all the cells in the body too. like the same issue.
All the what?
All the cells in the body. Every 7
I
years,
think
so
that's
that's
10
why you
years.
can kind of like outgrow allergies.
Yeah, so that goes more into the immune system. Our immune system is continuously developing, so you can actually grow into an allergy and you can grow out of an allergy. That's more with your maturation of your lymphocytes, attacking those things.
Oh, fun fact, when you get a tattoo, it goes into the deeper layer of the dermis. Just curious.
There you go. Which is a good thing because you're shedding your epidermis every day. So I mean,
Lasts very long.
you pay $700 on a tattoo and you lose it in 3 days. Yeah. I'd be pretty upset. So yeah, our dermis, that's the middle layer, and that's basically filled with capillaries, small arteries and veins. Our sebaceous gland, so anybody who's ever gotten a pimple. So at our hair follicle sits inside a sebaceous gland. When that becomes clogged, either from dirt, grime, sweat, or anything like that, it can actually develop into a cyst, and that's a pimple. So that's where our hair follicles sit up through. That's where if you get an abrasion, so you scuff your skin, road rash, or anything like that, that typically goes down to the dermis layer. So it's not like actively profusely bleeding, but you can see a little bit of blood that's sitting there, and that's a capillary bleed. So the sebaceous layer sits just below the dermis. I'm sorry, subcutaneous layer sits just below the dermis, and that's basically the fat component. It sits just above our muscle. Below those capillaries, there's more veins, nerves, arteries. Those all sit inside that subcutaneous layer. So if you ever go to a call with a laceration, they're going to ask you how deep. And if you look, do you see fat cells? If you see fat cells, then you tell them it's a subcutaneous laceration. Make sense? I can guarantee you in your lifetime you will see it. Yep.
Or relaxing.
Mine was my first one was a dog bite. The dog actually bit her calf off, and it was it ripped part of the muscle, but it was mainly down to the subcutaneous layer. You can see just that outline of her fat cells, her sheath right around her calf muscle.
You can see all that with a compound fracture too, right?
So depends if it's an open compound fracture or a closed compound fracture.
The open ones are the ones that protrude, right?
Yep. So a compound fracture is just a fracture that's basically sliced in half at the bone. And then we just differentiate if it's open or closed. So if you have an open compound fracture, That's the bone is exposed and sticking out versus a closed compound fracture. Good question. Any questions on the layers there? You're gonna have to know those.
Came up with first, second, third degree burns, it's just each
Yep.
layer
That's it.
of the burn.
Yep, so first degree is a sunburn. It's just our very superficial area. It sucks, it's painful, but it's not really that detrimental to your skin. Too much exposure to it, because our cells regenerate, the sun can denature our DNA in our skin cells. And we can develop, melanoma. Second degree burns, partial thickness burns, that includes our dermis layer. Those blister up, those can be painful. It doesn't necessarily fry our nerve endings, so we still have sensation there. But those can be kind of difficult to treat. You typically develop those pustules. Yep, you'll definitely develop scarring.
Second degree burn rate is bacon grease, and like
Yeah,
blister
bacon
up
grease
to
hurts.
Here.
Yep.
Disgusting.
What is the fluid in this?
It's basically,
Trying to protect.
it's our immune system responding to that site. And it's basically everything left over in that immune response building up into a pustule. Because it's not able to just excrete through our system into our renal system and out our digestive system. So it basically just builds up in that site, and that's just mainly our immune system's response of everything left over. There's some blood plasma left in it as well. But that's mainly part of our immune system. And then full thickness burns, those are burns all the way down to the subcutaneous layer. That is where our nerve endings sit. It can go down to the fat or the muscle or down to the bone. If it's down to the bone, it's actually called a fourth degree burn. It is actually a thing, fourth degree burn. If it goes down to the bone.
You don't
Yep.
feel it at that point, like you're definitely like done at that point.
Yeah. The only benefit to it is there's no pain to it. But other than that, it's killed all those cells in that area, all those tissues. So, yeah. Any questions on the integumentary system before I move on from it? See what I got. Okay, oh, we're doing good. You guys want to take a break real quick before I jump into this one? This one's kind of dense. If you want to break, now's your chance. Do that.
What's it called when it happens?
What's
When
that?
it breaks fully. I have a picture of it.
What breaks?
Or like in your wrist. It just, the whole thing just.
So that's a compound fracture.
My boyfriend's mom, we broke her full wrist.
Ouch.
It was bad. And she, oh yeah, and she already has her other wrist fractured, so she's.
Like currently, she's in a cat or
both.
oh my
Yeah.
god.
Carpal, or was it the end of the?
I don't know, I have a
Oh,
picture of
radio.
it. It's-
Oh yeah, those are.
Yeah.
Carpal. Red carpal.
And she can't drive.
Work fracture.
Whoa, the whole thing, they had to like, when they did it, she said they grabbed here and here and they pulled,
Mhm.
and then they went back in and they took an X-ray and did it again.
So that's called a fork fracture. It's called a fork fracture. So basically, when our wrist fractures, our muscles contract, and the reason I call it a fork fracture is, the shape of a fork. It's straight and then it curves up down to the points. That's exactly what our arm does in that situation. What's that?
College fracture.
Colles fracture. Thank you.
I was back here.
Yeah.
In these two red carpals. We get that all the time.
Oh, I'm sure.
It's like
So
my
what?
bread and butter, yeah. Or falling backwards.
Yep, that's what she did.
Fell backwards.
Well, she had the dog, so her other hand, my horse ended up hitting when she went up and knocked it, so she fractured 2 bones in her wrist. And
I've
then-
always learned snowboard fractures are wrists, ski fractures are ankles.
Knees are the big one for skiers. Yeah, that's the most common injury.
Yeah.
And everybody. clapped it. See more shoulder injuries than anything.
Oh, I bet. Piling it into a tree.
Falling on your side,
Yep.
falling forward, arms out, anything.
Yep.
And there's a lot, it's all trauma. Medical, we don't get.
Yeah, I know.
Once in a while,
Rare events.
you know.
Yep.
Somebody up in the lodge has a
Right.
reaction. And heart attacks.
Yep.
That's, they kill me.
Oh, yeah.
I've had, in 16 years that I was there, 10 heart attacks and only from true. Yeah. The other guy died, but we got him in the ambulance alive.
Yep.
Every other one we were doing CPR.
Yep.
Because they're so far up on the hill, and you try to do it the whole way. their
With
hearts
heart
are just
attacks,
bad.
what I found, unless it's witnessed, like they're in the back of our ambulance, they're having a heart attack and they go into a cardiac arrest, their chance of survival goes up to about 40%.
Mhm.
If it's unwitnessed, especially if it's up on a mountain, less than 5% chance of survivability.
Yeah, so I joined my first year, and everyone's like, "Oh, don't worry, nothing ever bad, really, really bad happens." And like I'd only been on patrol for a month, and I go to by myself. The guy had a heart attack.
Mhm.
Nothing bad, my ass.
Yeah, you guys suck.
You're like, what the hell?
What have I done? But I learned and do better now.
The biggest thing, cardiac arrest, that I preach to everybody, whether they're a paramedic or an EMT. Cardiac arrest, I can give them every drug inside our truck, and it's not going to make a damn bit of difference.
That's what everyone kept telling me. Don't beat yourself up. There's nothing you can do.
Yep.
9% don't make it.
Yep.
Doesn't make you feel any better.
Yeah.
I really want to live, but
I know. His perspective, he probably passed away in the spot.
it was
he
a
wanted
great
to be.
day. It was, and that's what everyone said. He was doing something. He was having fun, but he just dropped.
It's part of the reason I felt so
Right.
bad with that, cardiac arrest in Gansbury. Because where I didn't witness it, but we were in the store for like 10 minutes and she wasn't there when we went in. So she must have just barely, 2 to 3 minutes, I probably missed that one calling. And of course it happened the day after we started our first class. So
Oh, no kidding.
I didn't know what the hell to do at that point. If I did, I could have started running a lot sooner.
Yeah, it's all right. You don't know.
Yeah, no, exactly.
Usually, dispatch, so if you call 911 and that's their list of questions, is the person awake? Are they breathing? No to those, start CPR.
Right decision.
Start pushing. Something's better than nothing. Yep. Yeah, if it breaks, you're doing good compressions. I always pick on Russell because he's got kind of not to pick on firefighters, but he has the firefighter mentality. Like when he does chest compressions, I'm pretty sure he touches his spinal cord because he just sends it right through. These great compressions, but holy shit.
Not about half people on our department.
Yep.
People, they don't get called. It's just,
Yep.
Yeah, I'm sorry, but
nuts on these guys. They think they have to push as hard as they can.
You tell them you don't need to touch the backbone, just a little bit.
you guys do the different times of taking CPR. You taught us the 2 and 15 and 1 and 30.
But don't they have a new CPR that came out? That
All changed.
It's all changed. I know, because I go.
You
through
guys
the
are gonna learn the new way.
I go through that second class because we had, say, what, 3 or 4 hires last year or this year?
Yeah.
You guys went to a couple of them.
I went to 2 of them.
Yeah. Something,
Checking it.
Well, I didn't know it was serving a purpose or
Or
just like, yeah, well, that's kind of what I was thinking. Like, do we not want to touch the door handle? Door handles are dirty.
They are. So yeah.
I heard there was one where it's straight 100.
So the current standard that we're using for cardiac arrest, the old way was 30 and 2.
Right.
So for every 30 compressions, you get 2 breaths. That's changed. Now it's basically continuous chest compressions because what studies have shown.
because you're losing your pressure, your
Yep.
build up your pressure.
All about perfusion, right? The longer we can keep those organs perfusing, the better chance of survivability. So it's now changed that we are doing continuous chest compressions. Only time we're stopping chest compressions is if we're shocking them, checking a pulse. That's it. We're not stopping chest compressions to breathe for them. And how we're trained now is to time the chest compressions. So we're giving 1 breath every 10 chest compressions. That's where you got to work in unison. So as my compressor is coming up, I'm giving a breath to follow the chest rise. As my compressor is coming down, I'm releasing the BBM.
That's why a lot of people
And isn't the logic if you're doing it by yourself, that the compression of the lungs and not just
You don't do any breath.
Nope.
So somebody else.
Just doing chest compressions. Yep.
When is that? 'Cause I don't see it on the.
It is week.
Right, yeah, so, yeah, the reason.
August 16th.
Don't worry too much about the
That's the
reason.
CPR.
That's
Yep.
just, if you're doing your.
You get your AHA, BLS, CPR.
Yeah, don't worry.
See, on the thing, it says neurology.
But, so I'm going to, right, and that's
Well,
why.
I'm also
read
reading
the
the
book,
website.
then it has a right for you to be like.
Yeah, because he
did it, so
emailed
that's, I think
everybody.
that's.
Yeah. We adjusted it a little bit. I think this is the new
Yeah,
one.
and that's fine, so we're
Yeah.
just, I think we go, go in, it's body, that's, eliminate those. give them like certain- The Red Cross?
Yeah, like
EMS?
So Derek is a instructor for the American Heart Association to do BLS CPR.
I will,
So he's gonna be- Yeah, American Heart Association.
Yeah, I'm also the Red Cross.
And so that's a requirement to run in the state of Vermont under the EMT license, under any license for that matter. You can't hold an EMS license if you don't have your CPR cert. And it, you have to recert it every 2 years.
Yeah, but I'm doing it here.
Yeah. So everybody's gonna get it. So that way we're all on the same page. Yeah, we'll go over pediatric and adult cardiac arrest.
If he's cool with it, I might pull back.
Yeah.
If he's cool with it. Real curious. Now I gotta say that.
What's that?
Trying to find the.
Don't quote me on the exact date because I don't know if this is the updated one, but it's in August. I know that.
No, I'm just trying to find the updated one for David. Kingsburg never has one call. So it's always not on, it's always.
Yeah,
Would have been slowly starting to read this record and going right to you guys.
Enosburg's called us quite a bit lately too.
Oh, I believe it. Oh, there's, everyone's short staffed with that one.
Yeah.
I don't get why they just sell out, but
I know.
that's a whole other
Different subject.
discussion. Yeah.
So, yeah.
Doesn't make sense.
Is anybody here, is everybody here already BLS, like BLS certified, like CPR?
Yeah, we do it. I have to.
We
Okay,
are.
good.
We've done ours.
Okay, so yeah, because part of this, in the syllabus, I think it's resuscitation, we were gonna do the like BLS, so you all will either renew or get your CPR card. I don't know if that's what you're talking about.
Yeah.
Okay.
Yeah.
So I assume I'm just gonna get one when we do it because I was lifeguard certified, but like I never got a card.
Okay.
You know what I mean?
Yeah.
So, like, I
You're gonna
just
have to start at square one.
Yeah, so yeah, you'll have AHA BLS certification as of the, super card. that you're getting all those ones.
Derek will be your instructor for that one.
I did it in our EMR class. Airway.
Yeah,
Sure, so I did.
They're,
Oh, I might have.
they're good every 2 years.
Or with the spam or whatever.
Yeah, look out for it because it all comes electronic now.
Yeah.
They don't call it.
And it's like an e-card.
Yeah.
But the card, like,
Yeah.
Our fire cards use.
Yeah.
Yeah.
Yeah, everything's electronic. The only thing that will come in the mail is your license.
Uh-huh.
Your EMT license will come in the mail.
And your patch.
And your patch, yep. Vermont state patch.
I'm gonna have to have somebody else put that in.
Here we send it to a tailor. The tailor puts it on for us.
Even better.
Yeah. Alrighty, ready to get back into it? We actually don't have that much left. So it's gonna be a little bit of an early night. We'll probably be done around, it's an hour, 8:30 or so.
That's a bummer, huh, guys?
Oh, it's terrible.
Yeah.
I'll go deal with my crazy 3-year-old.
All right. Endocrine system. So the primary role of the endocrine system, it produces hormones to regulate bodily functions. So metabolism, growth, cellular production, and it also affects the autonomic nervous system. So the main components of our endocrine system are our pancreas, our adrenal glands, pituitary gland, thyroid, and then ovaries and testes. Those do play a component, but we talk more about those in the reproductive system. So anybody think of the main hormone? What's the main key factor hormone that's part of our endocrine system? Nope. Well, yeah, I'll take adrenaline. That's one. I'm looking for, all right, I'll change it. I want 3 of them now.
Come on.
So adrenaline's one.
Menopause?
Nope. You're close. Not a bad option. That's more towards reproduction. That's a good one. 2 more.
Blood cell,
What's that?
white blood cell production.
Nope. That's our immune system. Insulin. Insulin. Pancreas. Pancreas is sitting right there. So our pancreas, you can see, kind of plays multiple roles. But the major component of the pancreas is to support our endocrine system. So insulin was another one. Epinephrine is one. I wasn't expecting you to get the other. Norepinephrine. Yep, noradrenaline. The proper term is norepinephrine. And those are produced by our adrenal glands. So the first organ we'll talk about, incorporate. Yes, I did. Okay. So I'm going to work from top to bottom. Or I guess I didn't. Anyways, we're going to start with the adrenal glands. So the adrenal glands are actually glands that sit on top of our kidneys. We have 2 of them. There's one on each kidney. They're kind of triangular shaped, and they play a major role in the release of epinephrine. They also release norepinephrine. Anybody have any idea what norepinephrine and epinephrine do?
Epinephrine is that, isn't that opens up things?
Like what?
Like, no, you're breathing, isn't it?
Respiratory. So I was going to incorporate a picture on here, but it was actually really confusing.
How about stick figures? We always enjoy that.
Yeah, I do my stick figures.
Yeah, just watch with the lungs, okay?
So we have beta-1 receptors, beta-2 receptors. Actually, it's thrown this way. Alpha-1 and alpha-2. Okay, those are our main receptor sites in our system.
What was the first one you said? You said epinephrine. What was the other one you said?
Norepinephrine.
Okay, so what's that?
So,
Probably not.
nope, it's not. They actually work together. Those are 2 drugs we carry on the truck. We carry epi and norepi. And those are actually hormones. They're called catecholamines that are released by our adrenal glands. In our entire lifetime, our body produces 1 teaspoon of epinephrine. And you think about how much epinephrine we give on cardiac arrest. A lot. It's a lot.
To produce that much, is that good or bad?
For a normal body process, that's good.
You said a tablespoon?
Tablespoon.
How much do you give like somebody?
So an equivalent, it's diluted. In a cardiac arrest, we give 1 milligram of epinephrine, and so it's 1 to 10,000. So it's 1 milligram of epi in 10 mLs. In anaphylaxis, we give 1 milligram of epi. It's actually 0.3 milligrams of epi, but it's diluted 1 milligram in 1 ml. So it's quite a bit of epi that we give compared to what somebody produces in a lifetime.
That's basically just a good punch stuff.
Yep, that's exactly what it is. So if we think of our receptor sites, when you think of beta receptor sites, I'm going to make it as easy as I can for you here. Beta-1, 1 heart. Beta-2, 2 lungs. 1 heart and 2 lungs. That's where those receptor sites sit. So, if I give somebody epinephrine, epinephrine affects and bonds to the beta-1 receptor sites. We call it adrenaline. What does adrenaline mean? What does it do?
boosts our metabolism.
jacks everything up, right?
So that's releasing.
Exactly. So fight or flight response, what's that called?
That is.
What you got? Sympathetic response. So during a sympathetic response, our adrenal glands release epinephrine and norepinephrine to stimulate our heart and our lungs.
Oh.
No. I'll explain norepinephrine. Epinephrine increases our heart rate. It increases our heart strength. So how hard our heart is pumping, the actual force of the muscle. Yep. And it also increases the heart's velocity. What does that mean? How can you increase the heart's velocity?
Pressure?
Nope. Say it again. Not a shot.
Squeeze it harder?
Nope. That goes under strength.
Circulation?
Nope. So for velocity, remember when Joe talked about the electrical system of the heart? So that's basically how fast that electrical system is working, how fast it's sending signals through that electrical system. That's our velocity. This is actually called, I'm going way too deep into this, but it's called chronotropic, dromotropic.
Yes, I don't have to remember these words. It's not what happened anyways, so.
Those are those responses.
What's the last one you just proved?
Iodotropic.
So it boosts that pacemaker thing, basically?
Mhm.
Gotcha.
Yep. Our pacemaker is firing more often and it's firing faster. It's sending that signal through the system quicker.
This is given when some, basically, their heart's beating out.
Well, no, if I want this to happen, if I'm in a fight or flight mode, I want my heart to do this. If I'm going for a run, I'm running away from something, I want my heart to kick in.
Yeah.
Because if it's going 50 times a minute and I'm trying to run away, I'm going to collapse. It's not going to keep up, right? So beta 1, 1 heart. Beta 2, 2 lungs. What do we think epi does to our lungs? Opens them up. Opens your airway. So it's a bronchodilator. Okay. So somebody impending respiratory failure, it's an A-level skill. Somebody with impending respiratory failure, they can give them epinephrine, IM epi. And that will open up their lungs to allow air to flow through. So beta 1, 1 heart, beta 2, 2 lungs. Now where alpha 1 and alpha 2 come in, alpha 1 is vasoconstriction. Sorry. That's terrible. Anyways, you know, alpha 1 is vasoconstriction. Do we think epi dilates our vessels or constricts our blood vessels? Opposite. Constricts our blood vessels. Why would we want to constrict our blood vessels?
So it helps increase your increase your strength, velocity, and heart rate.
Mhm. Yeah.
More pressure.
Yep, exactly. So epi is a vasoconstrictor. What's that?
I should have thought.
I know.
I'd starve.
Next week. So it acts as a vasoconstrictor, and it actually doesn't really have any alpha 2 effects. Alpha 2 is part of our parasympathetic nervous system. So alpha 2 is stimulated during our rest and digest phase to increase digestion, secretion of enzymes.
Relaxing stuff.
Exactly. Norepi. Norepi is actually just like epinephrine. The only difference is norepi plays a greater role on this guy and less of a role on these guys.
Okay, so if you want to concentrate on
If I want to focus something on blood pressure and I don't want to jack their heart rate up, I'm going to give them norepi.
So what would the patient be suffering from? that
Good
would
question.
Make your decision to give him or her or that person patient.
The classic example is sepsis. Anybody ever heard of sepsis? Septic
You're
shock?
Yeah, you're like, you step on a nail and you don't let your mother know that it's rusty.
Yep.
And then you chill it, your foot lands.
Yep.
I remember.
So somebody's dying from septic shock.
Slowly, usually, over a period of time.
Yeah, well, it can be a quick process. Severely detrimental though.
Like a day?
Huh.
Like a day or that's 24 hours?
Depends how progressive the infection is. It could be over a day, it could be over a few hours, it could be over a week. Depends where the infection is and how progressive it is. So in that instance, in sepsis, I'm not really focusing on their heart. I'm focusing on their blood pressure. Why blood pressure? What does blood pressure do for us?
Keeps everything going.
How?
Oxygen, keeps it going.
Circulates everything.
It keeps, yeah, it improves circulation. More importantly, to give you an example, firefighter, if I have the engine as my pump, so the engine's working as my pump, as my heart, to force water through the hose. The hose is my arteries, my veins.
Right.
If I don't have pressure in those lines, I got nothing coming out the end. I've got nothing perfusing my tissues. You have to have that pressure in order to perfuse your tissues. That's why we check blood pressures. Somebody's blood pressure, we call it mean arterial pressure, MAP. It's that little number that your monitor gives you next to your blood pressure. So a MAP is basically a general rule of what your average blood pressure is in that one blood pressure. So a MAP, there's actually a calculation for this. We're not going to go over it today.
You're just a post driver.
I don't know, I didn't understand it that much until that analogy. I'm not even a firefighter, so I was like, okay.
It works. So a MAP of 65, mean arterial pressure of 65 or less. It takes 65 or more to perfuse our brain and our heart. Less than 65, my brain's not being perfused, my heart's not being perfused. If it's not being perfused, what's happening? Dying. Deoxygenated. Going to
You're
shock.
saying you need 65 basically to force the blood.
That's just enough.
That's the minimum, right?
That's the minimum.
That's the very minimum.
And that's what we're looking for in every patient. If they're below that, then we need to figure out why. Is it sepsis? Is it trauma? Is it I don't know, heart attack, pulmonary embolism, stroke? Any one of those things can cause that. So that's why we take that into account. So that's the difference between epinephrine and norepinephrine. Does that make sense? They're both produced by the adrenal glands. So that's those. The pancreas, we've already talked about it, but the pancreas's main function is insulin. Tell me again, what does insulin do? Keeps your sugar up.
It works, which is.
Kind of.
Didn't you
You're on the right track.
Key or something, it opens up the. So it goes through.
It opens up, it acts as a gatekeeper to allow our cells to take in glucose. We don't have insulin, our cells aren't taking in glucose, and they can't produce energy.
So insulin is like higher.
Yeah, it is. So if I go to a diabetic emergency and somebody's glucose is, say, 600, normal is 80 to 120
Ooh,
DKA, right?
major.
So they've got a lot of glucose circulating in their extracellular space, but it's just sitting there. It's not doing anything because that person's not producing insulin to allow that glucose to go into their cells.
Do they have to be active? If it's in there, maybe active and everything moving with the body and it'll start you'll start getting things going.
What do you mean?
Like, if it's just sitting there and, for example, you're saying they have that much there, right? If they're active, will it help, like, start pumping in and all that?
Nope.
Okay.
Because you have to have the insulin.
Okay.
If you don't have the insulin, your cells can't take up that glucose. Still gonna sit there, and it's only gonna go up. Yep, it's not gonna go down. So that's why we need insulin. So some diabetics are on insulin daily. There's insulin pumps, there's insulin injections. It's usually a lifelong thing once you go on insulin. Type 1 and type 2 diabetes, when we get into diabetic emergencies, you understand the difference between the two. It's just basically how you develop the loss of insulin in your system. Does that make sense how insulin works? All right, that's a key hormone, something we all need to know. When we get into diabetic emergencies, that's a big thing you're going to need to know. So yeah, that's the pancreas. The pituitary gland. It is. It's the size of a pea. It sits deep in our brain, and it actually affects every single organ system in our body. That little pea-sized thing, if you don't have the functional pituitary gland, you're not going to survive. So the pituitary gland primarily stimulates the thyroid gland and other organs with hormones to release hormones. So the pituitary gland is kind of the central system that is like the microchip in the brain. So it's monitoring things, it's regulating and determining, do I need more of this? Do I need more of that? Do I need less? So pituitary gland stimulates the thyroid gland to increase metabolism. Okay? It releases something called thyroid stimulating hormone. People go on levothyroxine. So if they have low TSH levels, it's because your thyroid isn't producing, your pituitary gland isn't producing enough thyroid stimulating hormone to stimulate your thyroid to increase metabolism. So a classic example of a non-functioning thyroid, just increased weight gain over a period of like a month. You just start to really build weight, and it's because your metabolism slowed down.
I think we're trying to bump that thing, thyroid gland thing as far as like obesity and stuff like that.
I haven't heard that I officially have.
Maybe it's just
Could be, I don't know.
something you hear on the news saying.
Yeah.
Those little clip reports saying that studies show that your thyroid's bad, it's not an excuse because of the swamp.
Right. I mean, it definitely plays an effect.
So you gain weight, your metabolism slows down.
You can't, that's just natural.
And your
It is. So over time, our metabolism naturally slows down. But if it slows down abruptly, at the age of 20, it's shutting down and it's not metabolizing or producing hormones to metabolize the food I intake. Fats are going to build.
That's the thyroid.
Yep. That's the thyroid in a nutshell. The thyroid plays multiple roles. It actually affects our blood pressure as well. We're going to go over the RAS system at some point. I don't think you guys really have to know it in depth. Paramedic school, if you guys go to paramedic school, you have to know that inside and out. But the thyroid affects the RAS system, which is the renin-angiotensin system. And that plays a role on our blood pressure. So if somebody goes on lisinopril, any of those medications, that's working on the RAS system. Okay.
Is it only specific to like the simple or any blood pressure?
Specific blood pressure medications. It's usually our prills. Can't think of another prill right now, but lisinopril is the main one. Yeah. So our thyroid gland, we talked about that. It regulates our metabolism. It works in our growth development, especially as a child, as we develop and grow. We need to produce bone structure. We need to produce muscle mass. So that plays a role in our growth, including our tissues and cells. The thymus. We don't ever really talk about the thymus. The thymus plays more of a role during our early childhood years because that's where our immune system is developing, is in the thymus. As we age, our thymus actually shrinks and it doesn't really become predominant in our immune system. But at a young age, that's where our immune system develops.
Does it get smaller because we developed immunity?
Basically because we haven't relied on it quite as much. Our immune system develops and matures over time as we get exposed to more foreign invaders and that kinds of stuff. There isn't really a demand for it. Coronavirus is a new virus to us all. As we expose to it, our thymus did play a role in that in our immune response.
This whole topic is making me want to watch that movie that came out when I was a kid, that cartoon. Like,
Osmosis Jones.
Yeah. Yeah.
That's way back.
I love that movie.
Chris Rock.
Chris Rock, yeah,
Was that a Disney movie or?
I think so.
Perfect, it's probably on Disney Plus.
Pretty much everything's owned by Disney.
Solid point.
Anyway, so yeah, that's the thymus.
That's what I'm like in Chris Hart lately, or Kevin Hart.
Kevin Hart, yeah.
Because he's just telling everybody to go kiss his butt,
Oh, yeah.
It's like, I don't care if your feelings are hurt or not. That's what a comedian does.
He's supposed to be in Borderlands.
All right, I'm gonna pause 1 second because my computer's about to die. So let me just plug it in real quick.
Yeah, I think Kevin, I don't remember what character Kevin Hart's twice in the lead Borderlands. Was there any Borderlands? I never played the game, so I don't know the characters, but.
The wokes are like trying to tear him down.
Who was the guy? The guy whose body they were. It was the guy that they killed in Zombieland.
Oh, Bill Murray.
Bill Murray.
Bill
Yes.
Murray.
Yes,
He's like a zookeeper.
I think so. Yeah, he eats like an egg or something. That's how he gets started. I'm not watching that movie now.
It's not on.
You watch it while you're studying anatomy.
Probably won't.
All right, so we talked about the thymus. We're going to talk about the ovaries and testes and reproduction. Yeah. Okay, so this is just a general picture of where the different organs sit in the endocrine system. So our pituitary gland is the most superior, that sits up in the middle of our brain, part of our brain stem. And then below that, we have our thyroid gland, which actually sits, kind of wraps right around our trachea. You can actually feel it when we do a cricothyrotomy. That's the one thing we have to watch, is not to nick the thyroid gland because it's very vascular. It bleeds a lot. So we just got to be careful with our incision, how deep we go with that. Below that, we have the thymus that shrinks as we age. We think at the size of our chest as a kid, it's actually fairly large. It sits anteriorly just over our heart, and just below our sternum. And then as it shrinks as we age. And then our adrenal glands, which sit right on top of our kidneys. Where adrenal glands come into play, we already talked about epi and norepi. There's actually disease processes that can affect that. We'll give a gold star to whoever can tell me the name of that disease.
That affects the adrenal.
What calls the EMS. Addison's disease. Addison's. So basically, Addison's disease is when the body requires steroids to stimulate our adrenal glands to produce and release epi and norepi. So that's not something we're going to diagnose in the field. It's usually people with Addison's disease actually wear a medical bracelet. Where they have it on a necklace or something around them, just to be aware of it. And the problem with it, if our body is not producing epi or norepi, we're not producing enough of it, what's that going to do to our system?
Thank you.
Thank you. It's going to decrease our blood pressure, decrease our heart rate, decrease our respiratory rate, and our ability to breathe. So those patients typically require a lifelong dose of some form of steroid. Our treatment's super easy to fix it. We carry 3 different steroids on the truck. Each one of them will kick their system to produce epi and norepi. So Addison's disease. Yes. Any questions on the endocrine system before we move on? Okay. Renal. So the renal system, or urinary system, it helps the body to regulate fluid levels, filters out chemicals, filters our blood. It's basically like our oil filter of our engine. I'm going to keep relating this back to mechanics. And it also adjusts our body pH. So the kidneys are the principal organ for our renal system. It's not the only organ in our renal system. We have our kidneys, our ureters, our bladder, and our urethra. 3 main components.
No, it's just that.
Yeah, your body, your body. Your book doesn't go into very much detail on the renal system. It's one of the big things we treat in EMS. It's one of the first systems to fail when somebody's going into shock. So whenever I do a transfer from you to UVM with a patient, I see lab values. The first thing I'm checking is their kidney function. Kidneys are the first thing to go in our body systems. Mainly because our kidneys act as the filter. So if we're starting to experience pH changes in our blood, if we're experiencing a buildup of a certain enzyme, our organs are starting to fail, the kidneys are going to take all that up and the kidneys are going to fail. So that's why the first thing we check if we're seeing somebody's shock status or how severely sick they are, we check the kidneys, kidney function. So the kidneys are a principal organ. Can people live without them?
They can live with one.
You can live with one. Yep.
They can't live without one.
So what happens if you don't have any kidneys?
Can't filter anything.
You get septic. Dialysis. That's what dialysis does. Dialysis acts as our kidneys because you need to filter the blood. So when somebody goes on dialysis, they have to receive dialysis 3 times a week for the rest of their life.
Actually, the Thomas taxi, I had a lady at the constant.
Depends what they have. What's that? Sorry.
So when I was working for a taxi company, I had a lady, she was a regular because she was on dialysis. I had to take her over all the time.
Mm-hmm. Yep. Yep. We deal with it. We have a dialysis clinic right up here that we go to often enough.
Yes, we were in the hospital.
Yep. There's a dialysis clinic up there. So that's what dialysis does. It acts as a filter when we don't have any kidney function. People can go temporarily on dialysis. So if they're in kidney failure, they'll put them on dialysis for a period of time to allow their kidneys to rejuvenate, catch back up, and basically heal. So it's not always a permanent thing. But if somebody is in kidney failure, they have no kidney function, then they go on dialysis the rest of their life, unless they're a candidate for a kidney transplant. So, yeah.
It also shortens lifespan, obviously, by a lot, even with dialysis, it doesn't get everything.
Yeah. I mean, in a way, it extends your lifespan because you didn't have dialysis, you're not going to live.
Yeah, true.
But,
Without a kidney.
right, in comparison, if you did have a kidney, yeah, dialysis does shorten your lifespan. So kidneys filter out our blood. They then take that remaining component and they release it into our ureters. From our ureters, those are tubes that feed into our bladder, and our bladder is basically a muscle. As our bladder fills, it usually fills up to about 350 milliliters before we get the sensation that we need to pee. So once we get that sensation, our bladder then contracts and pushes that urine through our urethra. In males, it goes through the prostate, traveling through the urethra.
Does that change if somebody has a catheter? How often?
Question. So what does a Foley catheter do? It does. Yep.
I just want to try.
Yep. So where does a Foley catheter go? In your urethra up to.
I didn't know like a common
condom catheter. Oh, not really. A Foley catheter, so we see that often enough.
The indwelling catheters.
Yep. People are sometimes on those chronically, so their bladder isn't able to function, so they can contract and release pee through their urethra. So in those cases, we call that urinary retention. People get a Foley catheter replaced, which is basically a tube that goes all the way up to the bladder, and then it naturally drains through that tube. So we're urine isn't. What's that? Yeah, Brad.
Watching pee after surgery. Quick as possible.
If you don't, you're getting the Foley. Foley catheter. No.
Is that the same process as, when I worked with prison, we had to do that. Forgive me if I don't remember the name of it, we'll call it shit bag.
Colostomy bag.
Yeah, that. That's the
So-
same process?
No.
Separate system. So,
And the catheters are surgically, they can be surgically. Plastic tube bubbles.
Yep.
In the side, you can keep the.
Yep.
Yeah.
Colostomy. Yeah, the colostomy bag is the actual bubble. Surgically take off. Outside of your body. Yeah.
Yep. So there's two forms. There's an ileostomy and a colostomy. Who the ileostomy goes to? Ileum. You're actually not wrong.
Oh.
What is our ileum?
Oh.
Small
intestine. Small intestine.
So an ileostomy bag goes to the small intestine. Colostomy bag, think colon,
Colon.
goes to the large intestine. Yeah. Yep. Yeah. So that's a Foley catheter, if you guys are interested in that. We encounter those often enough. If you ever have to go under any big surgery, you're getting a Foley. It's just one process that they can control. That way they can monitor your urine output. Why would you want to monitor urine output?
Color, how much?
What does color mean?
Well, you don't want to pee blood.
Blood's
well,
bad.
that,
Blood is
But
bad.
if it's clear, if it can clean up fluids and
If it's brown,
then you got other tubes. You're not drinking enough.
if you have brown urine is a sign of kidney failure. Brown urine's bad. You ever go to a patient and they have brown urine? Bad.
Odors for UTIs.
Odorous for UTIs, yep. Cloudy.
Yep.
Those are all
They
things.
better give it to me while I'm unconscious.
With the older population, you can kind of tell if they have UTIs, because especially if they're regulars, you won't be able to tell.
Yep.
Or if you're working in your.
It's a classic symptom. If it's good, and that's why urine.
Not even just by that, but they'll completely act different, so they won't be
Altered.
themselves.
UTIs are very common in the older population.
Mhm.
So yeah, we want to look at urine content. Ask somebody, how much have you peed? Have you peed once in the last 2 days? Have you peed 5 times today? It's actually normal to pee once every hour to every 3 hours. That is normal. If you're peeing once a day, that's not normal. It means you're not producing very much urine. It means your kidneys aren't functioning. So those are things we want to know when we ask our patients about it. Yeah. So this is just a diagram of our renal system. Sorry, it's not very blown up. But if we look at the top left, we see our kidneys. Inside our kidneys, we have what's called nephrons. So those are the little, to sum up, filtering sites for our blood. And byproducts are removed from the blood at those sites. So when somebody experiences kidney stones, it's typically where the stones develop, is in the nephrons. Super painful if anybody here's ever had kidney stones.
Yeah.
They're hurt.
When I really kidney stones, I think of the episode of Friends where Phoebe's in labor and Joey.
Mhm. Yep, it's super painful.
Uh-huh.
It's basically
There's
just
other
crystal
things that-
deposits.
I got, I was probably like 31 or 32 years old, and I
started feeling kind of funny, and like a couple hours later, I had to go to like a dispensary, and the doctor kind of put his hand, I thought I was gonna shoot right through the roof.
Yep.
But, oh, you got kidney stones. I'm like, what?
Don't
So
you
they had to
think
go
he
through
knows
all
how
that
to-
whole.
Mhm.
freaking
Depends how big they are.
process.
Yeah, if you can't do it, they go up and then you drive it.
They put me through the whole
Or jump
process.
off
They had to go get the
Yeah.
iodine pump, and then they had to do the freaking camera and shoot a movie up there and everything.
Yep.
And they found out, you don't have kidney stones, you have a urinary tract infection. I'm like, so you just put me through all that bullshit? And all
Find out you have an
did was give me
infection.
Antibiotics?
Yep.
Why did you give me the antibiotics first? Maybe that would do the job.
Oh, yeah.
That was military medicine.
Yep.
Let's like pull them open and see the fall.
Do first, ask questions later. Yep. So yeah, typically in kidney stones, that's where they develop, is in your nephrons. So our nephrons are a key component to our kidney function. Without our nephrons, we can't filter our blood. So we need to have those. Our kidneys are fed by our renal artery and renal vein. So it passes through our renal artery into our kidneys and then leaves our renal artery through the renal vein. And then that travels up through our ascending vein in our inferior vena cava. You can see our bladder. That's in general the size of the bladder. It's not very big. It sits in our lower abdomen towards our pelvis. Again, it's a muscle. It'll contract to remove urine. And then ovaries and testes, we'll talk about those later. That's just showing a picture of the urethra, male versus female. So in male, the urethra passes through the prostate. So someone with hyperplasia of the prostate, basically a buildup of cells around the prostate is a common thing. In older males, urine may not pass through the prostate and it may back up at that point. And then in that case, there is a surgical procedure to remove those cells. It's not comfortable, but it's one thing that can happen. Prostate cancer, definitely. So we have our ureters. We kind of already talked about those. Those transport urine from the kidneys to the bladder. So each kidney has one ureter that comes down to the bladder. That's usually the most painful part that we feel. That's where kidney stones get stuck, is in the ureters because they're pretty small. From the bladder, it travels through the urethra and is excreted from there. Any questions on the renal system? Actually, yeah, there's one thing I want to talk about on that. Sorry. pH. We talked about acid-base balance. We already talked about it a little bit earlier in the year. Our body, normal blood pH is 2. Nope, goes to what? You're right.
It's really low, 7.3.
Good. Love it. That's our normal blood pH. On a pH scale, would that be considered acidotic or alkalitic? Basic or acid? Normal pH, so water pH is 7.0. Right?
pH 7.5.
So if that's normal, this is slightly higher. Does that mean it's basic or acidic?
Acidic.
No.
Basic is below 7.5.
At least it's the problem.
Not a 50-50, don't go gambling. So if a pH goes down, that's acidic. If a pH goes up, that's alkalitic or basic. Okay. We need to know that for our kidneys because our kidneys react to the changes in our blood pH. So if our blood pH goes down, our kidneys then kick in and release a substance called sodium bicarbonate, HCO3 minus. It's actually a drug we get in the ambulance. Sodium bicarbonate. Well, this is just straight bicarbonate. So bicarbonate acts as a buffer. So if our pH is low, let's say our blood pH is 7.2. Is that considered slightly acidotic or alkalitic compared to our normal blood pH? 50/50 ain't wrong again.
You're just making sure they know the right
There you
one. By
go.
saying the wrong thing.
So it's lower than our normal blood pH. So if it's lower, it's acidic. Easiest way I can make you guys remember this, if it's acid or base. Hydrochloric acid. Strongest acid in comparison to hydrochloric, basically in the universe. The pH of hydrochloric acid is 1, super low. Our dish detergents, laundry detergent is basic, and an average laundry detergent pH is 10. So if it's low, it's acidic. If it's high, it's basic. Okay.
I was just gonna ask about how come it doesn't say anything that the blood goes through the vena cava? Did I pronounce that wrong?
No, you got it right.
How come it doesn't say that part of what we're gonna have to know?
And your book says it goes through the vena cava?
No, it doesn't say that at all.
Right. So that's more of our cardiac system. Because our vena cava, we have inferior and superior vena cava, and that is what feeds our right atrium. So the cardiac system, that's what you want to know. And
It's by the unoxygenated blood.
there you go. Yep, exactly. So with our pH, so you got that. If our pH is low, our kidneys kick in and release sodium bicarbonate, which is a base, to try and increase our pH. Okay? So when we're talking about our kidneys and the renal system, this is one substance you need to know that our kidneys produce. Oh, just bicarbonate. I'm sorry. I say sodium
got
bicarbonate
sodium.
because that's the drug we give. But it's actually bicarbonate is what the kidneys produce.
And pH be high?
Again, absolutely.
Absolutely.
So if the pH is high, what are our kidneys going to do? Say our pH is 7.5. Are our kidneys going to release bicarbonate, or are they going to withhold bicarbonate? Withhold it.
Do they release anything to bring it down?
It will filter some stuff out. So a good example of what it can filter out. Wait after this. Sorry, guys. Don't have to memorize that equation. But this equation is the basic system of our life. This is in continuous balance in our body every day, 24/7, for our entire life. This is what our body's monitoring, this equation. So if our pH is high, our kidneys are going to stop producing bicarbonate. With that, it's going to stop removing free hydrogen ions, because hydrogen ions are acidic. That's our acid, that's our base. That's our base, that's our acid. Again, you don't have to memorize this, I'm just showing you to explain it a little bit. But to show you how kidney function works, if our pH is high, it's going to stop producing bicarbonate, and it's going to withhold hydrogen ions in our blood. Try and lower that pH. Does that make sense, or am I totally losing you guys?
Yeah,
because then it's too high. I'll take that
If
out.
it's high, you don't want to add more.
Right.
It's gonna make it higher.
Yep. So when you're thinking about this equation, this half of the equation is focused on our respiratory system. This half of the equation is focused on our metabolic and renal system.
But didn't Joe say the pH could only be plus or minus like 0.5? So
Before you're considered fetal. So a pH of 6.8 or 7.9, you are considered not fit for life. You're not gonna live.
He's straightforward, it's like algebra.
Right? If I get somebody's lab work and I see that, it doesn't matter what we do. The chance of survival is not gonna happen. Everything breaks down.
When you say H2O is a base, you mean relative to normal blood, right? Because isn't that neutral?
Relative
in the
to
real world?
CO2.
Okay.
CO2 is an acid relative to water.
It's the driver.
And to understand that, you have to know the difference between an acid and a base. To sum that up, an acid is willing to give up a proton and accept an electron. A base is willing to release an electron and take up a proton. You don't have to know that. You want to know that, take chemistry. But anyways, that's just the comparison of those two. So in our respiratory system, if I want to decrease my acidity, a quick fix is to blow off all my CO2, increase my respiratory rate, so I can blow off all my CO2.
Mhm.
And that's why we see that in patients with PKA. Okay. Make sense with that? I don't mean to lose you guys in one tangent here. I'm so bad about that. Okay, moving on. Renal reproductive. So this is our last one, the last system. So the reproductive system. The male reproductive system consists of the testes and the penis. The testes are basically a functioning organ to release sperm development. It also is a center to release what major hormone? Testosterone. Exactly. Testosterone works to increase our metabolism. So a steroid that some athletes take is a testosterone injection. Increase their metabolism, increases muscle development, increases muscle. I call it reconstruction. It's basically when we work out, we break muscle to build muscle. So that just increases that process in order to build muscle faster. So the male reproductive system, you will go to some of these emergency calls. They're not that exciting. So in the male reproductive system, I don't know if you can read it really well or not. So we have the testes, and then we have the epididyma. And basically those are just centers for sperm development, blood flow to the testes, and then the epididyma is focused on the release of testosterone. Yeah, so some emergency calls that we go to for these, not my favorite one. Somebody takes too much Cialis, Viagra. Been to them. Basically what can happen, inadvertently, when they came up with the medication Viagra, it was used to be a blood pressure medication. One of the side effects of a blood pressure medication, I don't know, is extension, I guess. It's the only other way I'm going to put it. So if that prolongs, you can actually develop cellular death. Cellular death will basically kill your reproductive system. Same thing, a major emergency call that's actually a significant emergency, more common in teen populations is testicular torsion. Anybody ever heard of testicular torsion? So testicular torsion occurs when you'll see that the testes is connected. It's connected to the vas deferens, which is basically the tube. Yep, exactly. They basically just spin and it closes off all the blood supply to that testy. And it'll die. It's very painful.
Death from like a groin injury, a kick or something.
It can happen at any time.
Yeah.
Completely random. Yep. So those are extremely painful and those are emergent because it only takes 3 to 4 hours for that testy to completely die.
Another reason to donate, get paid and to avoid that.
The other one can twist too. Yeah. So
It's for what?
Jesus.
So I thought you were being serious.
I have no idea.
Sorry.
I don't know the value of one. All right, so anyways, yeah, testicular torsion, that's an emergency. That's something that we are definitely concerned about when they would need emergent surgery for to fix. Female reproductive system, it's comprised a little more than this, but the basic components include your ovaries, uterus, and vagina. So the book talks about it a little bit. So for the female reproductive system, we have the ovaries. What is a primary hormone that's released by the ovaries? Estrogen. What does estrogen do? Hormone. Any idea what it does? Plays multiple roles. Fertility. Works on metabolism. It actually plays a role.
Fetus development. No.
Yeah, kind of. Yeah.
Hot flashes?
Well, yeah, menopause. So menopause occurs when the female reaches a point in her reproductive cycle that she's no longer producing as much estrogen.
So she gets older in age?
Yeah, exactly. So inside the ovaries, God, I wish these were bigger pictures. Inside the ovaries, you have the egg or the follicle. So typically every 27 days, the egg or follicle moves through the ovary into the uterus, basically to await reproduction. What's a common emergency that you think we would go to for the ovaries? Those are severely emergent. Those can be detrimental. Anybody know what an ectopic pregnancy is?
When the egg fertilizes outside of the fallopian.
Yep.
Or if
Exactly.
I shouldn't say
Inside the
that,
fallopian tube.
it doesn't attach to it.
Right.
Inside.
So the egg doesn't make it to the uterus and it actually fertilizes inside the fallopian tube. Fallopian tube isn't made to expand and develop like the uterus is. It can burst and severe hemorrhage. They can bleed out from that. Another common one for the ovaries, ovarian cyst.
Ovarian cancer.
It's a very common one. Yep, ovarian cancer, ovarian cysts, endometriosis. That's a common
PCOS.
one. PCOS.
Yep.
So, yeah, those are common things with the ovaries that we can find. So the ovaries feed into the fallopian tubes, which then feed into the uterus. The uterus is basically the center where the egg will fertilize when it's exposed to male sperm, and then it'll develop into a child or a fetus. And then passing through the uterus, you get to the cervix, the vagina, the labia, that kind of stuff. So the major hormone to keep in mind with the female reproductive system is estrogen. That's kind of the major component. We do have emergency calls where we go to prolapse uterus, more common in older populations. Nothing we really do to treat other than to try and control bleeds. And we do a lesson on OBGYN emergencies, birthing emergencies. Yep. Yep. It's our most terrifying emergency that we'll probably ever experience. I've delivered one child in the field. Went well. Yeah. So we'll go over that once we get into OBGYN emergencies. And that is it. that concludes anatomy and physiology.
Thank you, sir.
You got it. Sorry, we're done. Yeah, right, 8:30.
iPad actually made it all the way. I thought it was good iPad.
We were told about some sort of homework.
Have a good one. Yeah, that's gonna be for Monday. I'm not exactly sure.
I wasn't sure what he wanted.
I don't know either.
He was his exact words were, write a song, make a PowerPoint, something along those lines
there's
of
nothing
how
written.
oxygen molecule enters the body.
I'm not really sure
That was
what
a direct
the,
quote.
I wrote down, Homer, list the order of locations.
I worked there.
regarding the heart.
And then again, it's like if you could make a song or, I'm like, okay.
Hang on, let me just stop the recording here. So I started recording.
And how important is it?
I have no idea.
I mean,
I don't think you're gonna get a grade for it, but I don't know that for a fact. Yeah, I don't believe so.
Go to the events. So I'm on.
I mean, it sounds
Oh, okay.
like you could just type in
Will we can.
YouTube, the process oxygen.
The old one, class, everything, they would like their,
Write it down into some sort of, I don't know,
Hang on.
step-by-step thing or.
1 second.
Just the route.
Yeah, I was in.
Where it all goes.